इस चलो Oh. Hello dear students, so hope everything is okay. So we are going to rock again together anatomy 360 degree. Can I get the chat box just to tell me all the audio video everything is okay? Just give me a few seconds. So please inform me at the chat box. I'm opening the chat box. So another very interesting session we are going to do. Just give me a few seconds for the different technical settings. Then we are going to start. Please inform me that audio video everything is perfect. Yes, here my system is okay. This three-dimensional orientation is okay. Yes, get ready with all your weapons. I am getting ready with all the weapons. And yes, what are your different weapons? Your eyes, your ears, your brain. Fine. Hello everyone. Yes, chat box is okay. Yes, thank you Deep, thank you Pooja, thank you Ramesh, Prakash. Yes, definitely Dr. Javed Muhammad. This is for the NEET PG 2023. Questions are going to ask from this session. How we are going to look, okay? Good evening, everybody. Good evening. Yes, Guru Vedanta, Dr. Ram. I'm very happy for you, beta, that you got selection. So very good student. Yes, Anshul, Ram, beta. So everybody, Salam Alaikum, Ram, Sat Sri Akal, Vadakkam. Everything is perfect. So can we start today's session? I don't know, whenever I see to all of you, your comments, then I'm getting the energy automatically. Okay. Yes, Bharat, this is the session approximately for the 2 hours. But if you all will enjoy, then we will go for the more the things. Again, I want to inform you all that many topics we are going to see. Look here, in bullet train anatomy, we had seen all the different PYQs. Just one quick revision, tabadtod session we are going to do here. Agree? But we are going to integrate with other subjects also. Remember, my dear friends, this session is especially for the NEET PG 2023. What are the different topics which are going to ask from the anatomy, and not only from the anatomy, but from our other 18 subjects also. Agree, everybody? Yes, beta. Yes, Anthony. Always will do. So I think everything is perfect. So let's start. Again, I want to inform you this session is going to be very helpful for the recent NEET PG. तो इसलिए इस लिंक को अपने दोस्तों तक धुआंधार तरीके से पहुंचा दो. ये बुलेट ट्रेन एनाटॉमी का अगला सेशन है, ताबड़तोड़. Yes, is any problem in our technical things? I'm just looking for it. Yes. Okay. So this is the continuation. What I'm saying, this is the continuation of the our bullet train anatomy second part. But here we are going to integrate with more and more subject. Okay. So we are starting this session. Yes. Few beautiful lines for all of you. Whenever I'm looking to all the students, then I'm getting energy automatically. So we are remembering to our respected teachers, our God. Yes. So that we can get the knowledge. And as usual, I want to tell you the same thing. Albert Einstein line, creativity is contagious, pass it on. We all are the student. We are learning from our seniors, from our teacher. We are just adding the interesting fact in it, okay, and then spreading to you, passing to you, okay. We all are the students, fine. And now it is your responsibility that you have to share this knowledge. Agree, beta? Now, see here again the same line. Before few days are there. No need to study the new things. I will also tell you the same thing. No new things. Okay. But I will make sure that which topics are going to ask in your exam. So remember this line from the Bruce Lee. I fear not the man who has practiced 10,000 kicks once, but I fear the man who has practiced one kick 10,000 times. Agree? So try to understand the our first session, head, neck, and our 360 integration. Agree, beta? So, okay, fine. So tell me, here is the first question, head, neck, anatomy, 360-degree integration. You have not only to think about the anatomy, you have to think for the other subjects also. So question is here. We had seen this question earlier in our bullet train anatomy. Again, try to understand. Patient presents with the drooping of the angle of mouth. Yes, this is the situation. And inability to blow. No kind of the whistling activity. Which of the following nerve is involved in the patient? Definitely this is our answer. What, sir? Facial nerve. Agree? Very good, very good, Rishabh, very good, Shri, very nice. Come to the next question. Fast, 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 we have not to stop. Yes, a patient complains of the headache with periorbital pain, tearing, lacrimation, drooling of the saliva, jaw spasm, pain with light and accommodation reflex. Can you see the light and accommodation reflex means third cranial nerve is normal and pupils neither dilated nor constricted. Again same features of the patient can be explained by the involvement of the which of the following. We had seen in bullet train anatomy. Don't do mistake, this is the rapid revision part portion. Tabadtod anatomy, tabadtod 360 integration. So what is your answer? Yes, in this question this is presentation of the trigeminal nerve. Okay, so answer is B. Fine, very good, Santhony. Yes, mummy dummy, you are right, beta. Now come to the next question. Yes, embryology, what I told you in bullet train anatomy session, you have not to leave the pharyngeal apparatus. One question is going to ask sure short. Okay, developmental defect in which of the following structures can cause tetany and absence of the thymus. We had seen this all the description. Yes, this brown color is showing the pharyngeal arch. Yes, this yellow color is showing the pharyngeal pouch, and this blue color is showing the cleft. Agree, everybody? Fine. So you can see this is nothing. This is the situation of, yes, in this our material, this PDF will be available at our Cerebellum Telegram group. Okay, so don't worry. Only focus over the slide. Yes, make active your brain and listen properly. Fine. So try to understand one topic definitely from the pharyngeal apparatus, clinical integration, and another is from the cranial nerve. Sure, in your NEET PG 2023, these questions are going to ask. Agree? Okay, so this is our pharyngeal apparatus. Can you see this is our situation of the Dye-George syndrome? Agree? So Dye-George syndrome, do you remember the mnemonic CATCH, catch 22? Okay, yes, in this situation there is the involvement of our this particular pouch. Yes, the dorsal part and the ventral part. Yes, these are creating our parathyroid 3 and the thymus. That's why answer is C. Agree? Now try to understand. Come to the next question. Which of the following muscle develops from the first pharyngeal arch? NEET PG 2019. Again it is saying, sir, question is going to ask from your pharyngeal apparatus. Can you tell me? First arch, it gives rise to the anterior belly of digastric. Yes, nerve of the first arch, sir, mandibular nerve. Posterior belly of digastric, it is supplied by, yes, it is derivative of the second arch. Getting the point? Yes, second arch nerve is facial nerve. So what is the nerve supply? The posterior belly of digastric, sir, facial nerve. Again, this is the question. This digastric muscle, I am showing you with the three-dimensional orientation. Look here. Yes, yes. So you can observe in this our three-dimensional orientation part. Look at the base. This is our single bone. Yes, the body, the great laser cornu, the greater cornu. The question had been asked previously. It is derivative of which arch? Remember, it is remnant of, it is derivative of the second as well as third arch. So you can see here one muscle. This is one muscle which is anteriorly, and here is another muscle which is posteriorly. Getting the point? Both concentrate over both are getting insertion over the hyoid bone, and there is the trochlear pulley. So put the hand in this way, anterior belly, posterior belly, both are over the hyoid bone. Agree? And anterior belly, sir, anterior belly is supplied by mandibular nerve, posterior belly seventh nerve. So MCQ, this is the only and only hybrid muscle of the neck. Yes, sir, it is hybrid muscle. So this is important topic. Different hybrid muscles we had seen in our bullet train anatomy part, but remember, in the neck, the digastric muscle is our hybrid muscle because it is having double nerve supply. Agree everybody? Yes, yes, yes. So hope you all are getting the point. Fine. So please inform your all the friends. We are going to integrate with the anatomy. Then we will talk about our different anatomy, surgery, medicine. Yes, our ENT, radiology integration. Now come to our next question. Can you tell me? Next question. 33-year-old male patient has undergone submandibular gland excision. Yes, Wharton's duct was ligated in the process. Which of the following nerve is most likely to be damaged during the process of ligating the Wharton's duct? Yes, can you tell me the answer? NEET PG 2021, and at that time I told you definitely one question from the gland in your NEET PG 2023. Either it may be the submandibular gland, or it may be your, yes, parotid gland, or it may be the thyroid gland, but it is sure, don't leave these three glands sure in the NEET PG 2023 surgery, medicine, or even integrating with your ENT or the anatomy. This question is going to ask. And also I told you the 3T, these topics are going to ask in your NEET PG 2023. Thyroid, tongue, tonsil. 3T, thyroid, tongue, tonsil. Agree everybody? Fine. So you are right. Yes, Raman, you are right. Lingual nerve. Why? Do you remember? I told you at that time, sir, there is our submandibular gland, and here was our duct, Wharton's duct. Do you remember the lingual nerve? Sir, lingual nerve was coming laterally. Yes, sir. Lingual nerve was coming laterally, then below, and then medially. So we had remembered this one LBW in place of the WM. Sir, this is our which nerve? Tell me beta. Sir, this is our lingual nerve. And one more thing. Yes, remember, तुम ही तुम हो तो क्या तुम हो, हम ही हम है तो क्या हम है. टीचर बिना स्टूडेंट नहीं और स्टूडेंट बिना टीचर नहीं. सो मेक दिस सेशन इंटरैक्टिव. मजा तो तभी है जब हम भी बोले और तुम भी बोलो. सो मेक कमेंटिंग बेटा. ओके, सो व्हाट आई वांट टू टेल यू, दिस निमोनिक इज LBW. This lingual nerve is laterally, then below, and then it is medially. There is the match, India and Australia, and today India got all out. Okay, so LBW, how's that you have to remember? So submandibular gland surgery is there. Best answer is lingual nerve. Now come to here. A 37-year-old met with the road traffic accident. Remember, in surgery many questions from the road traffic accident had been asked. Yes, see here, admitted with the skull base trauma. So there is the injury to the skull base, and there was the difficulty in swallowing. So problem in the swallowing. The doctor was touching. Look here, many students, they were asking this question after the bullet train anatomy. Here it is mentioned touching. Yes, the marked structure, which of the following cranial nerve is being tested? You are touching. If you are touching, then it is sensory judgment. But if you are looking the movement, then you are looking the motor nerve. Look here, this is the question. Which nerve is damaged? Can you see? Here what has been mentioned? Sir, touching was mentioned. If touching was mentioned, so for the touch, yes, we had discussed in the bullet train anatomy, For the touching, glossopharyngeal nerve is your answer. But if there is the movement, then vagus nerve is answer. Remember, vagus is also correct and glossopharyngeal is also correct. Getting the point? Fine. So remember, both are correct. But here only and only touching had been asked. Can you see? Yes, question is mentioning controversial question. Touching had been asked. It is not asking about the movement. Okay. So if touching has been asked, so best answer is C. Because when reflex physiology integration, you are stimulating the receptor. Afferent is going. Who is afferent? Sir, glossopharyngeal nerve is afferent. Who is center? Sir, medulla oblongata is center. And who is efferent? Sir, vagus nerve is efferent. And then palatine muscle. They are our, yes, effector muscle. So both are correct. But which is correct? Better answer. C is better than A because you are using touch. But if movement will be asked, means motor activity, in that situation vagus will be correct answer. After the bullet train anatomy we had seen. Hope everybody you all are agree with this. Okay, in bullet train anatomy we had seen. Now come to the next. Which of the following structure prevents the upward extension of the thyroid swelling through its attachment to the thyroid cartilage? So definitely 3T. Again I want to tell you, I am writing here the analysis. 3T. Yes. Cranial nerve. Yes. Pharyngeal apparatus. Yes. Glands. Which gland? Parotid gland, submandibular gland, and thyroid gland. These are the topics. I am damn sure, don't leave these topics, either surgery or medicine or ENT or the anatomy or the radiology. Any one question will be asked. 3T, again, remember, thyroid, tongue, tonsil, directly, indirectly, one question will be asked, sure. Agree everybody? Fine. So what I want to tell you, yes, now see here, which muscle is preventing? So there is a one muscle sternum to the thyroid. That is the sternothyroid. Hyoid muscle is, yes, our thyroid gland is below to it. So it is prevented upward dislocation. Yes, what I want to tell you, there is our thyroid gland and muscle is coming. Sir, sternothyroid is coming from the sternum to the thyroid. So here is attachment. So this sternothyroid is preventing upside movement. Yes, remember answer is B. Agree? Yes, Shri is correct. Dr. Rao is correct. You all are right, beta. Yes, Santani, you are right. Kishore Kumar. Yes, I am fan of Kishore Kumar. Okay. Zindagi ek safar hai suhana. Yahan kal kya ho kisne jana. So Kishore Kumar is here also. I am fan of Kishore Kumar, beta. Yes. So come to the next question. Which nerve passes through the foramen? Marked in the image below. So you can see this is our mandibular foramen. Yes, it is our mandibular foramen. Remember beta, just one concept. If there is one opening, so this is our foramen. If it is wide, then it is known as fissure. But if any opening is having long tunnel, then it is known as canal. Agree? Basic points like the our foramen oval, like the superior orbital fissure, and here is our optic canal. Agree everybody? Fine. Now you can see the nerve which is running inside here. Yes, remember the lingual nerve is coming here. Yes sir, lingual nerve is coming here. Yes, inferior alveolar nerve, better to say inferior alveolar nerve is coming, then it is passing through the canal and then it is coming out as the mental nerve. Answer is our inferior alveolar nerve D. Remember, there is a one clinical procedure for this. Our, yes, inferior alveolar nerve, there is an inferior alveolar nerve block which is done for the our dental procedure. Agree everybody? So that's why due to this clinical aspect, this question had been asked in NEET PG 2021 and it is a very important question. Can you tell me? Yes, thickened nerve marked in the arrow image shown below. So just to tell me which nerve is this? Yes sir, this is nothing. It is the nerve which is supplying the auricle. Yes, it is the nerve which will supply to the auricle. Remember, this is the great auricular nerve. Yes, it is having the anterior division and the posterior division. Remember this our nerve anterior division, it supplies to the very important sir angle of mandible, while this is our posterior division which is the major nerve of pinna. So don't forget it. This is the great auricular nerve. Don't forget it. This is the great auricular nerve. Remember, the root value is C2, C3. Single option if you have to mark, then C2 is the best answer. Why I am teaching you? Because this great auricular nerve is getting damaged. This great auricular nerve is getting damaged in case of the phrase syndrome. Very most important. Go for the bullet train anatomy. This is also known as the auriculotemporal nerve syndrome. Definitely questions are asked. This angle of the mandible in surgery integration, the same thing was asked as the our, yes, shaving area. So remember this phrase syndrome. Yes, in bullet train anatomy we had seen. Now come to here. We are not stopping here. Come to the our surgery integration. Yes, with the help of the anatomy, you can solve the question of the surgery also. See here. Question is, I am just putting the topic here so that you can crack the NEET PG 2023. 45-year-old male female patient underwent thyroidectomy. I told you one question sure from the thyroid. Agree everybody? Yes. Now 3 days after the surgery, she developed perioral numbness. Which of the following investigation you have to do? Definitely this is not the question of the anatomy, this is the question of the surgery. You can solve with the help of the anatomy. How? You know, there is our thyroid gland, correct sir? On the back side of the thyroid gland, you all are aware, sir, there are the location of the superior and inferior parathyroid on the posterior border. So when you are doing the thyroidectomy, in that situation our parathyroid gland is also getting sacrificed. This parathyroid gland is responsible for the parathormone, which is important for the calcium, phosphate and parathormone level. Agree? So only with the knowledge of the anatomy you can solve. Agree beta? So we are coming for the integration. Yes. Remember, hypoparathyroidism is a common complication of the thyroid surgery. Fine. Now come to the here. Next thing, which of the following is not seen in the main 2B? What I want to tell you, this thyroid, parathyroid is important, and there is our multiple endocrine neoplasia, multiple gland, endocrine gland, they are involved. So there is our neoplasia. It is divided into the main type 1 and type 2. Definitely one question from this main syndrome in your NEET 2023. Otherwise, directly, indirectly, the topic will be related in form of the pituitary gland. Yes. Remember our pancreas. Yes. Our parathyroid gland. Fine. So remember, parathyroid adenoma is not available in the main 2B. So go for the surgery. Main topic is important. Yes. Now see our topic, surgery. NEET 2022, one-liner type of the question pattern. Extra we are covering. Can you tell me? A 45-year-old patient, yes, complained of the pain in one side of the neck. तो गले के एक तरफ में क्या हो रहा है? Yes, दर्द है. She is afraid of eating food as it worsen the pain. तो जब भी खाना खाते हैं दर्द होता है. Ultrasound imaging of the salivary gland. What I told you, this is the session so that you can guess the topic. Again I want to tell you, sure our salivary gland surgery is definitely going to ask. Remember, there is our submandibular gland, parotid gland. Also you have to remember the sublingual gland. You have to study the pleomorphic adenoma also. For the parotid gland, you must study the parotid abscess as well as phrase syndrome. And ganglion topic I taught you already. So for the submandibular gland, you have to study the submandibular gland surgery, where one another question had been asked, that was lingual nerve damage. Yes, remember there is the one new invention, tubal salivary gland. Yes, new organ, that is the tubal salivary gland. Agree everybody? Tubal salivary gland, it is the newest organ, 81th organ according to the recent update. Okay, so near the opening of the auditory tube, minor salivary gland has been found. So this topic is important. So this is the situation. Remember, here you can observe radiology integration. So this is our anat, yes, surgery and radio conceptual brainstorming integration, where you can see the stone. So this is Sial. Sial means saliva. Litho means stone. So remember, this is very important, stone. Definitely in your NEET PG 2023, stone is going to ask either the gall stone or the renal stone, and include one more stone. Yes, salivary glands. Salivary gland you have to include. Agree everybody? Fine. Yes, yes, you all are right. Now see here one more इंपॉर्टेंट पॉइंट, द सबमैंडिबुलर ग्लैंड इट इज हाईली विस्कस, ये बहुत मोटा सिक्रेशन करता है, इसमें पानी कम होता है, इसी कारण से याद रखेंगे प से पैरोटिड, प से पानी पानी सिक्रेशन. फाइन. यस, पैरोटिड ग्लैंड pani secretion. The pani is also known as the serous. It is classical example of the serous gland, while the submandibular gland is opposite. It is thick, it is viscid. Okay, so it is mucus secretion. और क्योंकि ये म्यूकस है, गाढ़ा है, इसलिए यहां स्टोन बनने के चांसेस ज्यादा हैं. एग्री बेटे? गेटिंग द पॉइंट? Fine. So go for this all. Yes, yes, Anthony, you have to. Yes. So this is the discussion topic. Can you tell me what is the investigation of the choice? Yes, yes, yes. Type here. Now come to the next. Can you see? This is the question. A patient presents with the firm, tender, slow growing mass below the ear. Yes, sir. Below the ear. In bullet train anatomy we had seen. Yes. What could be the diagnosis? So just observe below the ear. 4 options we are there. So answer, this is the integration. I am not teaching the anatomy, I am teaching the anatomy integrating with the surgery. So surgery as well as ENT topic. This is the ENT integration. This is nothing, this is our parotid related swelling. Now it may be the mumps, yes, it may be the abscess. So among the option this abscess was given, so you have to mark the abscess. What I told you, hence proved. बेटा सबको समझ में आ रहा है? Are you getting? Yes. Are you getting the point? Definitely, definitely, definitely. Either the thyroid gland or the parotid gland or the submandibular gland related surgery is going to ask. So don't leave this topic. Agree, beta? So now come to our next integration. Can you see? Yes, this integration surgery and anatomy NEET 2022. Okay, you can see. क्या है बेटा क्वेश्चन? अ मेल पेशेंट प्रेजेंट्स विद द मिडलाइन नेक स्वेलिंग. मिडलाइन नेक स्वेलिंग, देयर इज अ एंटायर चैप्टर इन एनाटॉमी एज वेल एज ईएनटी एज वेल एज यस एनाट ईएनटी and surgery integration. Because here the slide is given, that's why you can say sir it is pathology conceptual brainstorming integration. Agree? This is very important topic. Yes. He later developed cervical node, तो गले में lymph node enlargement हो गया. The histopathology, sir, it is saying the pathology as well as histology of the lesion shown below. Which of the following statement is false regarding this condition? Okay, so there was the incorrect statement what had been asked. Remember, this was our diagnosis of, yes, you can remember, this is the situation of our papillary carcinoma of thyroid. Yes, Hurthal carcinoma, Hurthal cells are seen. So fine needle aspiration cytology was not the diagnostic. How can you identify? See here, you can identify with the branching papilla. Can you see here the papillary pattern is seen, branching pattern. Okay sir. Orphan ani nuclei, optically clear nuclei within the fine appearance. Can you see? These all are our orphan nuclei appearance, very very peculiar kind of the appearance you can see. Also there will be the pseudo inclusion are present and psammoma body. So don't leave this psammoma body. There are the many cases where the psammoma bodies are present. So go for this topic, psammoma body as well as this integration. Again you can see this is our, yes, thyroid carcinoma PCT. Getting the point? Fine. Yes, 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 you are right, but orphan and it is seen in the PCT part. Okay, now come to our next question. This is the classical question, you all are aware. This is beautiful integration of the anatomy, surgery, radiology as well as ENT. Agree? So can you tell me, a baby playing unsupervised was brought with complaint of the difficulty in swallowing. एक बच्चा था, खेल रहा था, उसने कुछ निगल लिया. For the last few hours the X-ray image is given below. तो आप यहां पर एक्सरे कर रहे हैं. व्हाट इज योर डायग्नोसिस? यस 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 यस, यू आर राइट. वैष्णवी, यू आर राइट. यस, वेरी गुड, वेरी गुड. प्रशिव, यस. श्री, फाइन फाइन. सो कैन यू सी हियर, दिस इज द इमेज, दिस इज द राउंडेड स्ट्रक्चर. So when you will see the coin, तो जब आप एक सिक्का देखेंगे सामने से, सिक्का, सो इट विल अपीयर राउंड, गेटिंग द पॉइंट, while when you are looking the coin from the lateral side you will see it is flat. Try to understand. Esophagus is collapse structure, transverse section, agree? So you can observe, can you see this is the coin, okay? ये coin है, ये गले में, अगर आप इस coin को देखेंगे सामने से तो ये गोल दिख रहा है, yes, coin is going in a rounded manner, yes sir, so it is in this way, so this is the transverse section. But look in our trachea, yes sir, trachea is having the hyaline cartilage and there is our, yes, remember, trachealis muscle at the back side, agree everybody? So you all are aware this is our, yes, trachealis muscle. So how this coin will go inside? ये coin ऐसा जाएगा, yes, this will be lying in this way, fine. So remember this is our esophagus. In esophagus, O for, yes, round appearance, yes, you can remember, you can take the help of this T, so you can remember it is having the flat, yes sir, it is having the T, flat appearance, both are from the front, agree beta? Yes, Ankur, you are correct, fine. Yes, Dr. Sanjeet, you are right beta. Everybody clear? सबको समझ में आ रहा है? तो ये एक्चुअली है सर्जरी का क्वेश्चन जिसको आप एनाटॉमी से बता सकते हैं. व्हाट इज द एनाटॉमिकल बेसिस? आई एम टेलिंग यू, ईसोफेगस इज कोलैप्स स्ट्रक्चर, ये पूरा बंद रहता है, तो जब सिक्का आएगा तो वो ऐसे जाएगा, सो दिस कॉइन विल अपीयर राउंड. आपका कॉन्सेप्ट मैंने बताया, एंड दिस इज द निमोनिक ईसोफेगस. O for round appearance, yes sir, O for round appearance, and this is our trachea. So trachea, yes, this is esophagus, esophagus from the lateral view. So when you will see from the lateral side, it will appear flat. Agree everybody? लेकिन trachea में उल्टा रहेगा. Yes, trachea is having the large anteroposterior diameter. तो सिक्का ऐसा नहीं जाएगा, सिक्का ऐसा vertical जाएगा. Fine. Okay. So now come to the next, what I want to tell you, not surgery integration, no excuse. Thyroid से क्वेश्चन आएगा, salivary gland से, and one more question, esophagus. Remember the narrowest part of GIT. This is our cricopharyngeal junction. Can you tell me the answer? एक आंसर बताना. Yes, this is where, sir, it is at the cricopharyngeal junction. कौन सा level? C6. Do you remember the bullet train anatomy? चलो बोलो भाई, C6 में क्या क्या चेंजेस हो रहे थे? Sir, the pharynx was ending at the C6, 1 MCQ. Next, the esophagus was starting at C6, second MCQ. Yes, larynx was ending at C6, third MCQ. Yes, the trachea was starting at C6. Next, narrowest part of the GIT, C6, cricopharyngeal junction. सबका मालिक एक है, हमने कहा था. Do you remember? Yes, so this is important. Now try to understand our pediatrics and surgery integration. Whenever the foreign body is coming here, in that situation, what you will do? Yes, what you will do? Remember, if it is passing the cricopharyngeal junction, nothing you have to do. Agree beta? Fine. Now we yes, always sweetie, God bless you all, don't hurry worry. Okay बेटा, याद रखना कि एग्जाम टाइम में प्रॉपर कंसंट्रेट करना. याद रखना बेटा, उस बच्चे का सिलेक्शन नहीं होने वाला जिसने बहुत ज्यादा पढ़ाई की हो, उस बच्चे का सिलेक्शन नहीं होने वाला जिसने बहुत कम पढ़ा हो. ऐसा कुछ नहीं है. सिलेक्शन उसका होने वाला है जो एग्जाम टाइम में उस 3 घंटे में प्रॉपर फोकस करता है. देयर आर द मेनी स्टूडेंट्स हु आर स्टडिंग वेरी लेस, बट दे आर हैविंग सच काइंड ऑफ फीलिंग, ओके यार मेरे फैमिली में ऐसा सिचुएशन था, मेरे लाइफ में ऐसा हो गया, वैसा हो गया. ओके, जाने दो, जो भी हुआ जैसा हुआ, फाइन. लेकिन अब जो वो आपके 3 घंटों का टाइम होगा उसमें जो प्रॉपर फोकस कर जाएगा, हो सकता है उसने बहुत कम पढ़ाई की हो, उसके फैमिली में ऐसे सिचुएशन आए हो, उसके हेल्थ में ऐसे सिचुएशन आए हो, लेकिन वो फोकस है. ठीक है यार, मैंने कम पढ़ाई की है, ओके चलेगा, लेकिन वो प्रॉपर फोकस कर रहा है, जो भी चीज पढ़ी उसमें से वो नॉलेज ले रहा है और उसके हिसाब से वो आंसर कर जा रहा है, आंसर सही मार्क हो जा रहा है, वो घबरा नहीं रहा है, उस 3 घंटे में फोकस कर रहा है. ये नहीं सोच रहा है कि सिलेक्शन होगा कि नहीं होगा. याद रखो, तुम फल की चिंता मत करो, सिर्फ कर्म करो। जीत मिलेगी या हार मिलेगी ये मैटर नहीं करता, आपको बस उस 3 घंटे में प्रॉपर फोकस करना है। बी कूल काम रिलैक्स। फिर से मैं कह रहा हूं, ऐसा कोई जरूरी नहीं है कि वो बच्चा जो बहुत ज्यादा पढ़ा है उसका सिलेक्शन होगा, ऐसा कोई जरूरी नहीं है कि कोई बच्चा बहुत कम पढ़ा है तो उसका सिलेक्शन नहीं होगा। ओके, वो जो 3 घंटों में खेल खेल जाएगा, जो हर चीज को प्रॉपर फोकस करेगा, अपने पढ़े हुए चीज से आंसर निकाल लेगा, उसका सिलेक्शन होगा बेटा। ओके, तो बिल्कुल अब घबराने की कोई जरूरत नहीं है। आपको जितना पढ़ना था, जैसा करना था कर चुके हैं, अब बस आपको आराम करना है, फोकस करना है। जो भी चीज आपने पढ़ी है, नोट्स पढ़े, उसके पन्ने पलटाने हैं बस। एग्री बेटा? फाइन, यस। बी अर्जुन, निश्चय यू आर राइट। चिड़िया की आंख, हमको सिर्फ चिड़िया की आंख को देखना है, ये नहीं सोचना है कि तीर चिड़िया की आंख में लगेगी कि नहीं लगेगी। ओके, सो नाउ कम टू द नेक्स्ट पार्ट। सी हियर, आई टोल्ड यू द वेनस ड्रेनेज ऑफ द फेस, और मैंने वहां पर जुगुलर वेनस प्रेशर आपको बताया था। डू यू रिमेंबर? जुगुलर वेनस प्रेशर, इट इज मेजर्ड इन द एक्सटर्नल जुगुलर वेन, और उस समय मैंने कहा था कि एक्सटर्नल जुगुलर वेन से जेवीपी मेजर करते हैं, एंड दिस जेवीपी इज वेरी इंपॉर्टेंट। सो जस्ट सी, directly indirectly question will be asked. The NEET PG 2022 medicine question, in our bullet train anatomy we had discussed, a patient presents to you with an irregular pulse of 120 per minute and a pulse deficit of 20, which of the following would be the jugular venous pressure JVP finding? तो यहां पर आपका आंसर है absence of the A wave. Do you remember anatomy integration हमने किया था? Yes, just recalling for all of you, this is suppose our face. Agree? Venous drainage of the face. Fine, sir. And here is our cranial vault. This is our mandible, ear, mastoid process. Agree? For the beauty of the image, yes, we are just drawing the eye. Yes, sir. Fine. Now, I told you at that time, there is the supratrochlear vein, supraorbital vein. Yes, sir. Both are uniting and making the angular vein. Agree everybody? Yes, 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 yes. Yes, God bless you बेटा, God bless you sweetie. Yes, yes, सैंतनी, अभी ऐसे बहुत सारी डिस्कशन हम करेंगे, बिल्कुल घबराना नहीं बेटा। देखो, आदमी या तो जीतता है या फिर आदमी सीखता है, आदमी हारता कभी नहीं है। यू विल नेवर लॉस द मैच। गेटिंग द पॉइंट? आप या तो जीतेंगे या सीखेंगे, और बिल्कुल आप सिलेक्शन दे करके ही रहेंगे। डोंट वरी फॉर इट। ओके, सो व्हाट आई वांट टू टेल यू, दिस इज अवर एंगुलर वेन विच इज रनिंग इन द फेस एज द फेशियल वेन, and at that time I told you that here is our mandible. Agree sir? So this is the mandible, one vein is running behind the mandible, so this is formed by the our temporal side running vein and maxilla side running vein, both are uniting together and they are making the vein which is running behind the what sir? Behind the mandible. So this was our which vein sir? This was our retromandibular vein. At that time in the bullet train anatomy I told you this is dividing into the anterior division and posterior division. Anterior division is uniting with the our yes facial vein and making the common facial vein, and it was opening into the what? You must remember the internal jugular vein. And at that time I told you there is the posterior auricular vein which is uniting with the posterior division. This is the posterior division of the retromandibular vein, and here is our posterior auricular vein which is making the external jugular vein. So you must know this external jugular is equal to 2 posterior. Yes sir, what are the 2 posterior? Remember, there is the posterior division of retromandibular vein and posterior auricular vein. Remember, it is not the pav bhaji, it is not the pav, this is the posterior auricular vein. So you can remember this posterior and this posterior, 2 posterior, they are making the external jugular vein. At that time I told you, yes, remember I told you the our jugular venous pressure, this external jugular vein, it is getting open. Yes, it is uniting, it is opening into the subclavian vein. Subclavian vein, it is uniting with the internal jugular vein. Yes, this internal jugular vein and subclavian, they are making the brachiocephalic vein. This brachiocephalic vein on the right side uniting with the left brachiocephalic vein, both are uniting and making the superior vena cava which is opening into the right atria. Yes, right atria, so it is indicating the right atrial pressure. So there is the wave, atrial contraction, atrial relaxation, and there is a small change. Yes, I'm making easy, atrial contraction, atrial relaxation. There is the our ventricular contraction and ventricular relaxation. Agree? एग्री एवरीबॉडी? अगर आप सभी को ये सारी चीजें समझ में आ गई हैं तो थम्स अप देना, आग लगा देना, फ्लावर दे देना, दिल दे देना. Emojis are very important. Fine. So this is the our JVP. Definitely one question directly or indirectly I am integrating with the anatomy. Yes. So there is the atrial contraction. So A wave. So there is the atria and the ventricle. So when atria is contracting, pressure is increasing. Agree, sir. And when there is the atrial relaxation, the pressure is falling. But at that time, ventricle, when the atria is relaxing, the ventricle is contracting. Due to the contraction of the ventricle, the tricuspid valve is closing. So remember the C for closer. So this wave is coming in this way. So you can remember easily, sir, this is C wave, closure of the tricuspid valve, and then ventricular contraction, and then ventricular relaxation. At the time of the ventricular contraction, when the ventricle is contracting, the pressure of the right atria is increasing, and this ventricular relaxation, so at that time the pressure is decreasing. Agree everybody? So what I want to tell you, these descents are known as, yes, definitely sir, this is the X, this is the Y. At that time I told you the external jugular vein is important. Okay, yes, directly indirectly question is going to ask. So there is the JVP question. Answer prominent A wave in case of the tricuspid, our stenosis. Okay, yes, we were solving this question. Another question, evaluation of the patient revealed a presence of a mid diastolic murmur. JVP showed prominent. What I want to tell you, you will see in the medicine. Definitely I'm not here to explain this all, but what you have to remember, JVP, what you have to remember, it is measured in the external jugular vein. That's why external jugular vein anatomy is important for the best memorization, best learning of the JVP. Agree everybody? Yes, yes, yes. Thank you Rocky bhai. Salam Rocky bhai. Yes, yes, yes. Ajay Kumar, thank you for your emojis, sir. My respected Dr. Govind Rai Garg sir is here. Sir, good evening sir. Pai Lagu sir, आपको प्रणाम है. Yes, so thank you very much sir for coming at this platform. Okay, so here just a few lines for the our cerebellum. Okay, so few lines for the cerebellum. कोई तुमसे पूछे कौन है सेरिबेलम तो कह देना कोई खास नहीं. एक दोस्त है कच्चा पक्का सा, एक झूठ है आधा सच्चा सा, कभी हंसने का कभी रोने का, बस एक बहाना अच्छा सा, राहों का ऐसा साथी है, नीट पीजी का ऐसा साथी है, जो दूर नहीं और पास नहीं. कोई तुमसे पूछे कौन है सेरिबेलम तो कह देना कोई खास नहीं, तो कह देना कोई खास नहीं. जी हाँ मेरे दोस्तों, ये खास नहीं है, लेकिन ये अपने आप में बहुत खास है. आप अपने कमरे में हैं, आप अपने साथ पढ़ाई कर रहे हैं, सेरिबेलम आपके साथ नहीं है, लेकिन जब आप देखेंगे, जब आप सोचेंगे तो सेरिबेलम ही आपके साथ है. सो थैंक यू वेरी मच for my all the respected teachers who are transferring the knowledge to me, and this is my responsibility. I am sharing this knowledge to all of you. और बेटा ये आप लोगों की रिस्पॉन्सिबिलिटी रहेगी कि आने वाले जनरेशन को आपको नॉलेज शेयर करना है. एग्री? सो थैंक यू वेरी मच सर. थैंक यू सर, थैंक यू. सो वी आर गोइंग टू कंटिन्यू. यस विष्णु, दिस इज ओनली फॉर द 2 आवर सेशन. लेकिन कहीं अगर आपको ज्यादा मजा आ गया, 100 से ज्यादा अगर बच्चे बने रहे तो ये सेशन चलेगा, बिकॉज वी आर नॉट ओनली सॉल्विंग द एनाटॉमी बट एट द प्लेटफॉर्म द एनाटॉमी, सर्जरी, मेडिसिन, ENT, डिफरेंट क्वेश्चन. ओके, सो वी आर गोइंग टू डू दिस सेशन अप टू द 2 आवर्स. बट इफ 100 students are continuing, then I will continue the session with the other subject integration. So it depends on you. लेकिन आपका टाइम इंपॉर्टेंट है बेटा. अगर आपको लगता है कि नहीं खुद की पढ़ाई करनी चाहिए, और मैं भी कहूंगा सेल्फ स्टडी इज द मोस्ट इंपॉर्टेंट राइट नाउ, तो बिल्कुल आप करेंगे. चलिए, विदाउट डिले, कैन यू सी हियर, आइडेंटिफाई द स्ट्रक्चर गिवन इन इमेज. यस, दिस इज योर ENT 2022. ये कौन सा बोन है? आंख बंद करके बोल दो भाई, एनविल शेप का है, ये तो इंकस है. आई एम शोइंग यू. यस, ENT 2022 बेटा, डोंट लीव दिस क्वेश्चन. ओके, वेरी इजी क्वेश्चन, नंबर बट रहा है, इसमें तो गलती करनी ही नहीं है. सो कैन यू सी दिस ब्यूटीफुल इमेज? लुक हियर. यस, cranial cavity, 3-dimensional orientation, just like the Iron Man, just like the Tony Stark. Look here, can you see the cranial cavity? Yes sir, here is the cranial cavity. Can you see? This is the petrous part of the temporal bone. Agree sir? So at time of the dissection, we use the chisel. Yes, we use the hammer and break this portion. So here the internal ear is seen. Can you see? Beautiful. The smallest bone of the ear is visible here. I am showing you the ENT 2022 question. Can you see? This is 9 into 10 mm square. tympanic membrane, which is pearly white in color, very small membrane, oval shaped. Yes, I'm showing you the different ear ossicles. Can you see? This is malleus. Yes, very small bone. There is the head, there is the neck, there are the two processes, long process and the short process. Yes, you can see there is the our, yes, incus. This is ENT 2020-22 question. ENT 2020-22. These bones are very small, so the surgery of this area is very difficult. So remember ear ossicle. Yes, remember middle ear cavity. Remember the CSOM. Very important in this नीट पीजी आपका क्वेश्चन आ रहा है मिडिल ईयर कैविटी CSOM और ASOM. ग्लू ईयर हैड बीन आस्क्ड इन नीट 2021 ENT. वी विल सी. लेकिन बेटा पानी की तरह क्लियर है. यस, you have to go for the PYQ. Look at the question pattern on the 2020-22 ENT. Then immediately go for the question for the 2021 ENT. You will see there are the few questions which are repeatedly asked. Definitely the question, that topic is very important for the next NEET. 80% chances. Okay, थोड़े बहुत अप डाउन हो सकते हैं, but you cannot leave that topic. Just like the, yes, TB of the middle ear cavity. Yes, TB. Okay, तो अगर कान का TB होता है तो उसमें painless hearing loss होता है. That is also important. Okay, so these all are the very important topic. Fine. Yes, good evening. So here MHD sir is with us. Hello sir, very welcome to you and thank you for supporting to me as well as to the children's. So here we are having the blessings from all the great teachers, all the great legends. So we are going to look for our question again. Yes sir, agree? ENT NEET 2020-22 question, incus. So what I want to tell you, yes, ear ossicles or disease, definitely here is the important topic list I am telling you. Yes, ear ossicles or middle ear cavity and diseases, just like CSOM is very important, also the ASOM. These are important. No excuse for the anatomy ENT integration. Agree everybody? Fine. So now we are going to look for the next. Yes, Anthony, multiple perforated painless. Very good, better, very good. Now we are going to look. Yes, thank you, MHD sir. Thank you. You are also the same sir. Every faculty at the Cerebellum team. Yes, we are having the WhatsApp group. All the teachers are so much thinking for the students. Every teacher is thinking so much for the students. This is really very beautiful. So hats off to all the members of the Cerebellum team as well as its student. You all the dear students are amazing और आपके कारण हमको एनर्जी मिलती है. Now see here, can you see our ENT NEET PG 2020-22? The tympanic membrane anatomy is important. Yes sir. Remember tympanic membrane anatomy and then abnormality. If there is an abnormality, then it is our ENT. So without anatomy ENT is not possible. बेटा ENT तो तभी बनेगा चाहे nose, ear, larynx, pharynx, anything you are studying. First you will start with the anatomy of that structure. So definitely you have to do, yes, tympanic membrane anatomy. You all know rounded structure and there is the handle of the malleus. There is a cord like nerve which is running here and you can see there is the our cone of light on the anteroinferior angle. That's why you have to do the myringotomy on the posterior-inferior angle. Yes. So you can compare that image. And here you can see the bubble, OA, bubbly, bubble. Yes, nothing, no any kind of the pus is seen. So this is what? पानी है कान में. तो ये तो हमारा ASOM or better to say suppurative otitis media, which is also the glue ear. Agree? Can you solve? Fine. Correct, Ankit. So clapping for the Ankit. Very good, beta, very good. You are right. You are writing the very fine. 9 into 10 mm is your, yes, surface area, dimension of the our middle ear. Yes, tympanic membrane, and our tympanic membrane is compressed cube like structure. Yes sir. So its structure is compressed cube like. So you all can remember the dimension. Yes sir. So just I am telling you one way how to remember the dimension. Sir, the length is 15 mm. Yes, the length of the middle ear cavity is 15 mm and here you can remember it is largest 6 mm. और 6 कैसे आता है सर? 4 और 2, यस सर, आपको 4 और 2 को जोड़ना है. So can you remember this simple way? Yes sir, this is 4 plus 2 is equal to 6. Fine. And the length is 15 mm. अगर आप इस 1 और 5 को जोड़ते हैं तो भी 6 आता है. Just one way. So you can remember. Yes. Fine. Okay, so now we are going to do. Yes Jitendra, thank you beta, thank you. Jitendra is my one of the very favorite student. Okay बेटा, हम कारागंडा आएंगे, कजाकिस्तान आएंगे और वहां क्लास करेंगे, और जितेंद्र हम डिनर करेंगे बेटा. ओके, यस थैंक यू बेटा, थैंक यू. सो वी आर गोइंग टू लुक. यस, विशाल बिस्वास इज हियर आल्सो. ओके, अरे भाई कोई किसी को डिस्ट्रैक्ट मत करो भाई. फाइन. Okay, so now we are looking. See here, ENT NEET 2021. Following the total thyroidectomy, a patient started. Again, I told you thyroid. आंख बंद करो, क्वेश्चन आने ही वाला है. थायराइड से क्वेश्चन आएगा ही आएगा. पेशेंट स्टार्टेड हैविंग डिफिकल्टी इन ब्रीदिंग एंड रिपीटेड अटेम्प्ट्स टू एक्सटुबेट वेयर अनसक्सेसफुल. द मोस्ट प्रोबेबल कॉज इज, बताओ क्या है? Yes, all the muscles of the larynx, they are supplied by recurrent laryngeal nerve. Do you remember? Yes, recurrent laryngeal nerve. Getting the point? Fine. Okay. All the muscles of the larynx, they are supplied by the, yes, recurrent laryngeal nerve, except cricothyroid. Yes, hope you all are aware for the our bullet train anatomy. I don't know where is the file exactly. Okay, I'm looking at the Telegram channel. At the Telegram, yes, we all had seen. I'm looking for the bullet train anatomy. Yes. PDF. Yes, sir. Here is the our bullet train anatomy part. Can you see here? Yes. We all had seen these pharyngeal apparatus part. Yes, all the details of the pharyngeal apparatus, Dijorge syndrome, derivative phase. Yes, I told you this, our formation of what? External jugular vein, JVP, dangerous area of the face, these all are important. Yes, blood supply of the face we had seen. Okay, different. Now trigeminal nerve is very important and facial nerve is very important. Yes, in a very funny way we did this. Priya Prakash Warrior, go for the bullet train anatomy. It is very important. Trigeminal neuralgia, Salman Khan. Yes, our integration with the gamma knife surgery we had seen. So these all are our beautiful integration. Agree? So what I want to tell you, at that time I inform you about the one classical situation. Yes, these all things we had observed there. In the cranial nerve part, I told you there is the one table. That was all the muscles of the larynx are supplied by what? Sir, all the muscles of the larynx, they are supplied by recurrent laryngeal nerve. There are the 4 exception. Okay, I'm just looking for that slide. Yes. At the Valentine Day, we were doing I love you joke. So that time we had seen larynx. All the muscles of the larynx supplied by, no excuse, recurrent laryngeal nerve, except cricothyroid, which is supplied by the 4th arch. Yes, it is supplied by the nerve of the 4th arch, 10th nerve, superior laryngeal nerve, also you can say external laryngeal nerve. We did this joke. Okay, एक लड़का होता है, एक लड़की होती है. लड़का लड़की को कहता है आई लव यू, लड़की कहती है कि ये तो मैं जानती हूं, कोई नई चीज बताओ. तब लड़का बोलता है yes, all the muscles of the pharynx, they are supplied by what? Remember the vagoaccessory complex, the pharyngeal plexus, except stylopharyngeus, yes, which is supplied by the nerve of the 3rd arch, glossopharyngeal nerve. So no excuse with this 4 statement. So with the help of this anatomy, you can solve the question. You can solve this question. Yes, it is supplying all the muscles of the larynx. So laryngeal muscles are getting paralyzed, especially which muscle? Remember the safety muscle. This is another question. Posterior cricoarytenoid, which is safety muscle. Can you tell me which is the safety muscle of the tongue? Okay, which is the safety muscle of the tongue? yes correct बेटा, correct. yes अभिषेक, लॉजिक को RIP बोल दो, अब तो बस क्वेश्चन बनने चाहिए. ओके, yes you are correct बेटा, you are correct. So do you remember the safety muscle of what? Safety muscle of larynx. It is our nothing, posterior cricoarytenoid. Fine. It is supplied by recurrent laryngeal nerve. Yes, it is abductor of the vocal cord. So if it is getting paralysis, then there is the closing. Getting the point? So these all are the our points. That's why you have to remember. Yes, tell me, which is the safety muscle of tongue? What I want to tell you, definitely one question from the tongue, definitely one question from the thyroid, definitely one question from the tonsil. 3T, they are important. Okay, yes, very perfect. Dr. Nishchay, you are right. Yes मेडिको, yes you are right बेटा. मौज कर दी, हम मौज ही करेंगे. पढ़ाई लिखाई से अच्छी चीज और कुछ भी नहीं है, बस नजरिया चेंज करना है. सेफ्टी मसल ऑफ द टंग, yes we have to give the respect. G Genioglossus is the safety muscle because it is responsible for the protrusion. And at that time we had song, we हमने एक गाना गाया था, the song which is dedicated to the tongue. Hollywood, Bollywood, Tollywood, they all depends on the our anatomy. Can you tell me the song dedicated for the tongue? चलो एक गाना गाते हैं. तूने मारी एंट्रियां तो दिल में बजे घंटे यार. टंग 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 टंग. Remember, tongue topic is very important. Okay, agree everybody? So yes, Janvi Patil, you are right beta. Dr. Rao, you all are right. So don't forget this 4 things. Okay, now see here, there is a question. ENT NEET 2021. Yes, we are looking the ENT question at the platform of the anatomy. So ENT anatomy conceptual brainstorming integration. Patient presents to the emergency with the epistaxis. Agree, sir. There was no relief on pinching the nostril. Agree, sir. Nasal packing was done, but the patient still continues with the bleed. What would be the next appropriate step in the management of this patient? Yes, just only, no need to study the ENT right now for this question. You have to remember only one thing, that is artery of epistaxis. Yes, sir. And definitely this is our sphenopalatine artery. So with the help of the anatomy, you can solve the ENT question. Agree everybody? Fine. So hope you all are getting the point. Fine. Okay medico. Yes beta, हो गया वही. Sphenopalatine, yes. Janvi Patil, very good beta. Ankit, ligate the sphenopalatine artery, very good. So with the help of the anatomy, you can crack the ENT, you can crack the surgery, you can crack the medicine, you can crack the radiology. Fine. Now come to this question. ENT NEET 2021. Nose bleeding is important. The question is going to ask from here. A patient with history of chronic ear infection. Yes, sir. Ear infection. Very most important. Definitely question is going to ask with the ASOM, CSOM complication. Presents with the fever, headache, vomiting, irritability, and confusion. CT brain. Yes, sir. CT brain means this is your radiological conceptual brainstorming integration. Shown in the image below, what is the possible diagnosis? Can you see here? Yes. See here. Radiology. So you can observe clear cut. There is a formation of abscess here. Yes. This is nothing. This is our temporal lobe. Yes, sir. This is anterior cranial fossa. Here is middle cranial fossa. This is posterior cranial fossa. This is our temporal bone part, and there is the our abscess in the temporal part. So this is our temporal abscess. Getting the point? So answer was the temporal lobe abscess. Agree everybody? Fine. So hope you are getting the point. This is not only the anatomy, but the anatomy 360 degree. We had rotated this anatomy. Yes, anatomy 360 degree we had done the integration with the surgery. Yes, with the JVP medicine. Yes, we had seen with the our ENT. Yes, we had seen the integration with the radiology. So we are going to do the more and more integration. Also the histopathology we had seen. So the pathology. So anatomy at the center, and on the basics of the anatomy you are approaching for the other subject. That's why in the previous session I told you, मेरे बच्चों, मैंने कहा था ना 18 सब्जेक्ट पढ़ने से पहले एनाटॉमी पढ़ा जाता है. So remember, if your anatomy is strong, then definitely damn sure your other subjects will be strong. Agree everybody? So we are going to look for the our more things. Okay, so this is our beginning of the neuroanatomy 360 degree integration. So just tell me, you all are enjoying or not? Yes. Till now, what are the different topics for the NEET PG 2023? श्योर शॉर्ट क्वेश्चंस आर गोइंग टू आस्क। अगर ये टॉपिक नहीं आए तो मेरा नाम बदल देना, ओके? दूसरा नाम क्या रख देना? यस, एनाटॉमी 360 डिग्री रख देना। नाम भी मैं बता दे रहा हूं। फाइन। सो व्हाट आई वांट टू टेल यू, डेफिनेटली यू हैव टू लुक फॉर द ग्लैंड्स। यहां से क्वेश्चन आएंगे ही बेटा, ओके? सो रिमेंबर यू हैव टू द ग्लैंड्स। व्हाट यू हैव टू रिमेंबर? द ग्लैंड्स। विच ग्लैंड? यस सर, अवर thyroid gland, submandibular gland, parotid gland. Yes, you have to look in the ENT, you have to look in the surgery, you have to look the thyroid, anti-thyroid drugs, you have to look the Frey syndrome, this all. Yes, 3T, they are important. Tongue, thyroid, tonsil. Sure questions are going to ask. Cranial nerve, sure the question is going to ask from the cranial nerve. No excuse beta. Agree everybody? Yes. Remember, there are the our more things we had seen in embryology. Definitely you have to look for the pharyngeal apparatus. Getting the point? And with the ENT, middle ear cleft and diseases. Fine. And also the brain section, many things we are going to look for it. Okay, so we are going to start, but before that, hope you all are enjoying. अगर आप सभी को मजा आ रहा हो तो एक छोटी सी शायरी आप सभी को लिए। बेटा लाइफ में कभी भी हारना नहीं। हम सभी बहुत ही छोटे लोग हैं, लेकिन अगर हम हिम्मत रखें, हम हौसला रखें तो हर चीज को जीत सकते हैं। याद रखिए इन लाइनों को, रास्ता भी जानता हूं, चलना भी जानता हूं, मैं आग हूं, तबीयत से जलना भी जानता हूं। ये लाइनें आपको अपने लिए कहनी है। रास्ता भी जानता हूं, चलना भी जानता हूं, मैं आग हूं, तबीयत से जलना भी जानता हूं, मुझे मोम न समझो जो झट से पिघल जाऊंगा, मैं सूरज हूं, डूबकर निकलना भी जानता हूं। तो याद रखिए बेटा, अभी आपका नीट पीजी का एग्जाम है, बिल्कुल टेंशन नहीं रहना है। आराम से जो पढ़ा, जितना पढ़ा, कम पढ़ा, ज्यादा पढ़ा, ओके, सब मोह माया है। आराम से, कोई टेंशन अपने को नहीं रखना है। उस 3 घंटे में आपको प्रॉपर फोकस करना है। बी कूल, काम, रिलैक्स। कई सारी चीजें आएंगी, कई सारी चीजें जाएंगी। अगर इस युद्ध में हम जीत जाते हैं तो क्या वॉर खत्म हो गया? नो, इसके बाद भी संघर्ष है। अगर इस युद्ध में बाय द वे सिलेक्शन नहीं हुआ तो क्या जिंदगी खत्म हो गई? नो। जब तक हम कोशिश करेंगे तब तक याद रखिए कि आप जीतेंगे। जिस दिन आपने कोशिश करना छोड़ दिया, जस्ट गिव मी फ्यू सेकंड्स बेटा, ओके, देयर इज अ लिटिल टेक्निकल प्रॉब्लम। यस, जब तक आप कोशिश करते रहेंगे तब तक आप जीतेंगे, और जिस दिन आपने कोशिश करना बंद कर दिया उस दिन आप हार गए। सो रिमेंबर दिस पॉइंट्स। फाइन, ओके। सो जस्ट आई वॉज हैविंग द वाटर एट द टेबल, लेकिन जोश में ये पानी जो है वो नीचे गिर गया। ओके, तो इसको हम थोड़ा सा प्रॉब्लम को सॉल्व करते हैं। सो माई टीम इज हियर, हिडन टीम, जो कैमरे में बिना आए अपना काम चुपचाप कर रही है। ओके, बहुत जल्दी हम आपको अपने टीम से भी मिलवाएंगे। फाइन, सो थैंक यू वेरी मच। ओके फाइन, तो आगे लगे। यस, आग लग गई है, पहले भी आग लगी थी, अभी भी आग लगी हुई है। यस सर, फाइन। सो कैन वी डू एक चीज समझ में आ गई कि जब पढ़ाते रहो तो आसपास टेबल में भैया गिलास विलास बिल्कुल नहीं रखना, कांच वांच फूट फट जाएगा। बहुत जोरदार आग लगी हुई सभी बच्चों के साथ। ओके ओके बेटा, देखो टेंशन नहीं लेना, टेंशन लेने से कुछ नहीं होता। बी कूल, काम, रिलैक्स। सिलेक्शन होगा या नहीं होगा, इसके अलावा कुछ नहीं। सिलेक्शन हो गया तो क्या जिंदगी खत्म नहीं हो गई? ओके, क्या आप जीत गए, आप सब चीज कर लिए? ऐसा नहीं है, तब और टेंशन बढ़ जाएगा। और बाय द वे, सपोज आई एम नॉट टेलिंग नेगेटिव, लेकिन फिर भी समझने की कोशिश, अगर सिलेक्शन नहीं हुआ तो क्या जिंदगी खत्म हो गई? अरे यार, अब तो जिंदगी में कुछ बचा नहीं। ऐसा नहीं है बेटा, ऐसा कुछ नहीं होता। ये बहुत ही छोटा सा पड़ाव है जिससे आप होकर के गुजर रहे हैं। ओके, और एक बार जब ये पार हो जाएगा तब आपको लगेगा अरे यार, ये नीट पीजी एग्जाम भी कोई एग्जाम था। अभी बहुत टेंशन लगेगा, लेकिन जब इसको पार कर जाओगे तब ये बहुत आसान लगेगा। ओके, एग्री? सो नाउ वी आर गोइंग टू लुक। यस मम्मी डमी, थैंक यू बेटा। सो वी आर स्टार्टिंग अवर न्यूरो एनाटॉमी 360 डिग्री इंटीग्रेशन। चलो स्टार्ट करते हैं। ये सारे क्वेश्चन हम सॉल्व कर चुके हैं। कहां पर? यस सर, अपने बुलेट ट्रेन एनाटॉमी में। सो दिस वाज अवर बुलेट ट्रेन एनाटॉमी पार्ट। यस, वी आर गोइंग टू इंटीग्रेट विथ, यस, ये सारी चीजें हम वहां पर देख चुके बेटा। एटलीस्ट आप पीडीएफ को टर्न करोगे। फाइन, सो वी आर लुकिंग फॉर दिस अवर न्यूरो एनाटॉमी क्वेश्चन। दिस ऑल आर द सेम थिंग्स। टेल मी द आंसर क्विकली। अ पेशेंट presents with the ballistic involuntary movement. Remember, projectile throwing movement of half of the body is our ballistic movement. कब होता है? आपका आंसर है सर, दिस इज सीन इन केस ऑफ द डैमेज टू द सबथैलेमिक न्यूक्लियस ऑफ द लुइस. एग्री एवरीबॉडी? यस एंथनी, यू आर राइट बेटा. Come to the next question. NEET PG 2021. A patient presented with the vision loss. उसको आंखों में कुछ नहीं दिख रहा है भाई. Radiological examination and aneurysm. Yes sir. Aneurysm causing damage to the optic chiasma was found. Which of the following artery is most commonly involved? हमने bullet train anatomy में इसका discussion कर लिया है. Yes. Can you recall this blood supply of the brain? स्पेशली द सर्कल ऑफ विलिस इज इंपॉर्टेंट. याद रखोगे मेरे बच्चों, जब हम छोटे थे स्कूल में जाते थे, ऐसे ऑफ द काउ वॉज इंपॉर्टेंट. यस, गाय हमारी माता है, हमको कुछ नहीं आता है, समथिंग लाइक दैट. वन फनी जोक, डू यू रिमेंबर? यस, काउ. राइट नाउ द काउ इज ऑल्सो इंपॉर्टेंट. व्हाट इज दिस काउ? सर, दिस इज सर्कल ऑफ विलिस. So cow is always important. Agree everybody? So what I want to tell you, yes sir, we had seen there is our two arteries. Sir, this is the vertebral artery uniting together and making the basilar artery, and this basilar artery is dividing into the posterior cerebral artery. Yes, also remember, this is very very important topic. Sir, here is our internal carotid artery. Yes sir, here is the internal carotid artery which is joining the posterior cerebral artery. This internal carotid artery is giving the anterior cerebral artery which is anastomosing together with the anterior communicating artery. And sir, here is our middle cerebral artery. So you can observe the beautifully this our circular anastomotic channel. Yes sir, this is our circular anastomosis. This is circle of Willis. Remember our optic chiasma. Sir, optic nerve is coming, and it is dividing in this way. Okay, so whenever this anterior communicating artery it is enlarging, there is the damage to this our optic chiasma. Agree beta? सबको समझ में आ रहा है? Fine. Yes, निश्चय, you are right, that is the joke. इस जो, चलो इसी बात पे एक जोक हो जाए. एक बार क्लास में काऊ के ऊपर ऐसे आता है, काऊ के ऊपर ऐसे आता है, उसमें ऐसे में बच्चा लिखता है, गाय हमारी माता है, हमको कुछ नहीं आता है. अब टीचर कॉपी चेक करता है और उसको नंबर देता है. क्या लिखता है? बैल तुम्हारा बाप है, नंबर देना पाप है. सो रिमेंबर दिस सर्कल ऑफ विलिस. यस, सी हियर, इफ इन दिस सर्कल ऑफ विलिस देयर इज द aneurysm, so that is our Berry aneurysm. Getting the point? Yes. So if there is the Berry aneurysm rupture, then subarachnoid hemorrhage, very 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 most important topic. और रेडियोलॉजी के साथ इसको हम इंटीग्रेट करेंगे. यस, मेडिसिन के साथ इंटीग्रेट करेंगे. रिमेंबर द वर्स्ट हेडेक ऑफ माय लाइफ विथ माय वाइफ. सॉरी, ऐसा नहीं है, ऐसा नहीं है. यस, द वर्स्ट हेडेक ऑफ माय लाइफ, दैट यू हैव टू रिमेंबर, दैट इज द अवर सबएराक्नॉइड हेमोरेज. जस्ट इन अ फनी वे सो दैट यू कैन रिमेंबर. जरूर एक क्वेश्चन आने वाला है. यस, योर सर्जरी एंड द मेडिसिन conceptual brainstorming integration. Agree everybody? What I want to tell you, there is our dura mater, there is our, yes, arachnoid matter, and there is our pia mater, and definitely here is our brain. Agree? So if there is a blood outside the dura mater, extradural hemorrhage. Blood below the dura mater, yes, subdural hemorrhage. Below the arachnoid matter, subarachnoid hemorrhage, and below the pia mater, intracerebral hemorrhage. Sure, one question. Yes, extradural hemorrhage, subdural hemorrhage. This is our, yes, subarachnoid hemorrhage, and here is intracerebral hemorrhage. NEET PG 2023. Sure beta, sure question is going to ask from here. Agree? Yes, thunder clapping headache. Dr. R. Vaito, you are right beta. Now try to understand extradural hemorrhage due to the rupture of the middle meningeal artery. Sure, it is going to ask, it is passing through the pterion. Subdural hemorrhage due to the our rupture of the cortical veins. Yes, subarachnoid hemorrhage is the most common cause. Remember the rupture of the Berry aneurysm. Intracerebral hemorrhage due to the hypertension. Agree everyone? So these are the important points which you have not to forget. Fine. So now look here, come to the our next question. A patient presented with the clinical features of, yes, answer in this question. Optic chiasma damage, that's why anterior communicating artery. A patient presented with the clinical features of the ataxia, okay, with incoordination, means its cerebellum is not working properly. Yes, so definitely cerebellar artery has gone. Which is the artery of the cerebellum? Yes, remember, superior cerebellar artery, anterior inferior cerebellar artery, posterior inferior cerebellar artery. Now see where these options are given, nothing, only this is having the cerebellar, so this is the answer. One more thing you have to remember, this pica is getting damaged and it is causing the lateral medullary syndrome, it is causing the Wallenberg syndrome. Again, for the NEET PG 2023, you have to prepare this brain stem syndrome. Yes, what I want to tell you, brain stem syndrome, definitely this question is going to ask for all of you. Agree? Fine. So now we are going to look for the more things. Yes, just give me few seconds for the technical settings. Yes, everything is perfect. Yes, everything is perfect. Now we are going to, yes, Dr. MHD sir, yes, ये तो गड़बड़ हो गया, but yes, it is just a joke, we have not to take this seriously. Okay, so we are going to look for the our next question. NEET PG 2019, NEET PG 2019, which fiber is marked by the arrow in the image given below? So at that time I told you the mnemonic. Yes sir, this is the our first fiber which is joining the right and left C, the thin septa separating the lateral ventricle S, and below to it there is the very small structure F. Sir, these are corpus callosum, yes, septum pellucidum, F for you have to remember the fornix. Agree everybody? Fine. Now I told you that there is a very thin partition. Yes, it is the midline of the brain. Yes sir, this is our third वेंट्रिकल. गेटिंग द पॉइंट? ओके, मैंने बताया था कि थर्ड वेंट्रिकल रेडियोलॉजिस्ट का दोस्त होता है. इफ दिस थर्ड वेंट्रिकल इज गेटिंग शिफ्ट ऑन द राइट साइड, देयर इज द मास ऑन द लेफ्ट साइड. इफ इट इज गेटिंग शिफ्ट ऑन द लेफ्ट साइड, देन देयर इज द ब्रेन ट्यूमर और एब्सेस ऑन द ऑपोजिट साइड. एग्री एवरीबॉडी? सो दिस इज आवर थर्ड वेंट्रिकल. फाइन. सो जस्ट on each side of the third ventricle, sir, these are our, definitely you can say, thalamus. And do you remember this was our caudate nucleus? You can see there is one boomerang shaped structure. This is nothing, sir, this is our internal capsule. Yes, internal capsule was having the anterior limb, posterior limb, genu, and the part behind the lentiform nucleus. Can you see? This is the lens shaped nucleus, lentiform nucleus, which is having the two part, medial and lateral part. Yes, globus pallidus and our putamen. And at that time there was the one question I told you, this is our, yes, putamen. Don't forget this one. Forget the Spider-Man, forget the Batman, forget the Aquaman. Don't forget this, our putamen. Spider-Man, forget it. Putamen, तूने चुराया मेरे दिल का चैन. Don't forget, this is the question. Putamen is the lateral most nucleus. So this is the internal capsule. Internal capsule is nothing, it is the bundle of the tract, and tract, they are classical example of the projection fibers. Agree everybody? So don't forget it, projection fiber. I told you the gray matter, yes, functional area of the brain, and white matter, yes sir, this is our Brodmann's area. And white matter, remember that mnemonic ACP. Okay, so just one quick review of that all our part we had seen in the bullet train anatomy, this all the cadaveric images practice. Yes, third eye of the Lord Shiva, the pineal gland we had discussed with the biochemistry integration. This flow chart we had filled at our bullet train anatomy session. Please go there. Parkinsonism and the Wilson's disease, they are important, we had seen. And I told you the different part. Definitely damn sure this question is going to be used, this topic, is going to be used in your NEET PG 2023. Without it, you cannot do. Yes, we had integrated with the prefrontal lobe syndrome. Okay, our Munna Bhai MBBS and Chota Chhatri, Kaju Katri, anominal aphasia. This all the things, aphasia, speech topic is very important. And we had seen the homunculus representation. Yes, the circle of Willis. Please go for that notes. Okay, yes, we had seen the circle of Venice cadaveric images in our previous session, and this was the point which we discussed. White matter of the brain, Rowdy Rathore we had discussed. Yes sir. A for association fiber, C for commissural fiber, P for projection fiber. Who is the real Rowdy Rathore? ACP Rathore. Remember, Fornix is the ACP Rathore. Getting the point? Yes, Dr. Vaishnavi, please go for the bullet train anatomy. There we had discussed already, so I'm not wasting the time. Okay, so please go. Yes, Dr. Vaishnavi and all the dear students who had not seen, please go for that our previous video, beta. Okay, fine. So ACP, remember the internal capsule is the bundle of the projection fiber, bundle of the our, yes, remember, bundle of the tracts. So internal capsule, corona radiata, all kind of the tract, they are projection fiber. Agree? Now come to this our next question. Area marked in given image. Yes, this is the umbilicus. I told you all the body dermatome in detail. So this is our T10. Agree beta? Fine. Yes, Dr. Zen Mode. It is available at the YouTube. Go for the Cerebellum Academy channel. Okay, and here what I want to tell you, there is the one video, bullet train anatomy, I think approximately 10 days before. Okay, so every theory I taught in the 7 hours, 7.5 hours. Okay, so you can get from here. Fine, I'm not repeating that same thing. Now see here, identify the structure marked in the image given below. Okay, so I told you the way, sir, this is C, here is S, and this is F. What are these different things? Yes, corpus callosum, septum pellucidum, and here is our fornix. Getting the point? And after that I told you the THP. Yes sir. T for thalamus, H for hypothalamus, and P for pituitary. Agree? Do you remember the THP, CSF, THP? And then I told you the mnemonic MPM, midbrain, pons, and medulla. Yes, sir, midbrain, pons, and medulla. I told you the thin pathway within this midbrain and then pons and the medulla. Yes, sir, this is our third ventricle. Here is the fourth ventricle, and this is our central canal, and definitely this is the fern tree like appearance of the cerebellum. Okay, no excuse from the cerebellum. One question damn sure from the cerebellum. Yes, before very time, yes, earlier I was always saying one question from the cerebellum, either from the anatomy or from the physiology or from our, yes, pharmacology. Lithium is the cerebellar toxic drug, important statement. Okay, or the medicine, Romberg sign, this all in our bullet train anatomy we had seen all the things. So go for that video. But again I want to mention this cerebellum is important. One question is sure from the cerebellum, but now we can say every question is going to ask from the cerebellum. Okay, so we are going to look for the more things. Yes, तो हमने यहाँ पर एक ट्रिक देख लिया सर, that is the our CSF, then THP, then MPM. Agree? At that time I told you one more thing, vote. Can you recall? 1, 2, 3, 4. These are the 4 formula. Do revision. Corpus callosum, septum pellucidum, fornix, they are always in sequence. Thalamus, hypothalamus, and pituitary gland, they are always in sequence. Midbrain, pons, and our medulla, always in sequence. Vertebra, and then esophagus, and then there is our trachea from the posterior to the front side. Agree everybody? Fine. So now we are going to look for the next. Yes, tum hamare piya. Yes, mummy dummy, you are right. There was the mnemonic. Yes, I forgotten, but you recalled. Yes, tum hamare piya. You are right, beta. Tum hamare piya. That was our mnemonic. Fine. So now, very nice, mummy dummy. I will remember your name, beta. Yes, you recall. Yes, next question. NEET PG 2018. Broca's area is situated in which part? So inferior frontal gyrus, superior frontal gyrus, angular gyrus, or post central gyrus. So just look for this our areas. Yes sir, Broca's area, it was located at the inferior frontal gyrus motor speech area number 40 and 44 and 45. While the Wernicke's area, it was located at the posterior part of this our auditopsychic area number 22. Agree everybody? Very good, very good. Whenever I'm looking the Kishore Kumar, I am recalling the great singer Kishore Kumar. Okay. So thank you Kishore Kumar for joining. I will always remember your name beta. Now we are going to integrate surgery NEET 2020-22 question. Okay. See here. I told you bleeding is going to ask. Can you see? Integrate. I'm not teaching the surgery right now. I'm not official teacher for it. Yes, I cannot teach surgery. It is different thing. What I'm doing, I'm just integrating the surgery and anatomy. Okay. So definitely you are better in knowledge in surgery than me. Okay. But just with the help of the anatomy, I told you that our circle of Willis, yes, गाय हमारी माता है, हमको कुछ नहीं आता है, बैल तुम्हारा बाप है, नंबर देना पाप है. We had seen circle of Willis. Yes, the question is going to ask. And there is our Berry aneurysm. Question is going to ask. And this is also known as a saccular aneurysm. So whenever there is the damage, there is a subarachnoid hemorrhage. That is the worst headache of my life. थंडर क्लैपिंग हेडेक. ऐसा लगता है जैसे दिमाग के अंदर कोई ताली बजा रहा है. यस, ऐसा लगता है कि दिमाग के अंदर बिजलियां कड़क रही है. सो दीज आर द फनी लाइंस विच यू कैन रिमेंबर. एंड डेफिनेटली यू हैव टू गो विद द रेडियोलॉजी. नो एक्सक्यूज. Definitely one question from this all the topics NEET PG 2023. Yes, radiological basis you have to practice. This PDF will be available at our beautiful platform Cerebellum. Okay, so now look here, another question. Radiology integration NEET 2020. A patient complaint of the neck stiffness on the platform of the anatomy we are solving. Okay sir. And severe headache. Okay sir. CT image shown below is suggestive which of the following condition? Agree? So can you see? Sir, this is exactly the portion where there is formation of circle of Willis, internal carotid artery, anterior communicating artery, yes, anterior cerebral artery, anterior communicating artery, and here is the posterior cerebral artery. From the downside, two vertebral arteries are coming and uniting, making together the, yes, from the downside, vertebral arteries are coming, making the basilar artery and the posterior cerebral artery. It is getting rupture. So, can you see? It is our subarachnoid hemorrhage, neck stiffness, severe headache, and blood in the basal cistern. This is our basal cistern portion where the opacity is visible. Agree, everybody? What I want to tell you, you can solve this question at the platform of the anatomy also. Anatomy 360-degree. We are integrating the radiology with the anatomy. This is not the question of the anatomy, it is the question of the radiology. लेकिन जब आप एग्जाम हॉल में जा रहे हैं तो उस समय अगर आप सोच रहे हैं अरे मैंने वो टॉपिक नहीं पढ़ा, ये टॉपिक नहीं पढ़ा, नो, डोंट थिंक दिस ऑल. You have to focus for the question. Yes sir, there is the headache, and look at this portion. I taught you in the our bullet train anatomy part. Yes, can you see this one? This is our vertebral artery, basilar artery, and this is our basal cistern portion. Exactly here is the bleeding. Can you see the anterior communicating artery which is compressing the our optic chiasma? Yes sir. So you can solve this question on the platform of the anatomy also. Agree everybody? Fine. So try to understand. No Zen mode abhi upper limb lower limb nahi hua beta. We will learn that and we will integrate that topics with our, yes, orthopedics. See here, I want to tell you that circle of Willis portion again. Look here. Can you see? Yes sir. Can you see? This artery is the main artery of the head neck face. This is our common carotid artery. Can you see? It is dividing into the external carotid artery, and here is the internal carotid artery. This is artery which is running inside the cranial cavity through the carotid canal. Agree everybody? Now look here, there is the one another artery. Sir, this artery is passing through the vertebra. That's why this is vertebral artery. It is the branch of which artery? Sir, subclavian artery. Do you remember VITCD? Branches of the subclavian artery, important. V for vertebral artery. I for internal mammillary artery, which is used for the coronary artery bypass grafting. Yes, VIT. T for thyrocervical trunk. C for costocervical trunk. D for dorsal scapular artery. Agree everybody? Getting the point? So this is the vertebral artery. Yes, it is the first part. Fine. In the neck. Yes, cervical part. Then second part is passing through the sixth thoracic vertebra, not through the seventh. Yes, 6, 5, 4, 3, 2, 1. So this is the vertebral part, and then it is passing below the occipital bone. Sir, this is the suboccipital part, and then this vertebral artery is reaching within the cranial cavity. Fourth part, internal carotid, yes, intracranial part. This question had been asked that, yes, this vertebral artery is related with our which portion? Remember, you can see this is our vertebra, atlas. So this third part is coming from the vertebral canal and it is reaching to this portion. Okay, getting the point? Yes, remember this is the part which is joining the spine with the transverse process. Okay, so it is passing over here. Getting the point? So this is the lamina part. This is the related to the third part. This question had been asked in your INICET. So just I want to tell you, yes, revise that, all the things. Yes, yes, Sneha, you will get this PDF at the Cerebellum Academy, our telegram group. Okay, now look here, the cerebrospinal fluid CSF specimen of the patient is shown below along with the microscopy. The report shows mononuclear cytosis, elevated proteins and low sugar. What of the following, what is your etiology? So definitely you can observe this, all the things. Mononuclear cytosis, sir, it is saying about our tuberculosis. Fine, so you will get, there is the elevation of the protein, cobweb appearance of the CSF. So again I want to tell you, CSF is important. So remember CSF examination, especially with the meningitis, it is very important for your NEET PG 2023. So remember this tubercular meningitis is especially one question sure shot from the TB, leprosy, hepatitis, so on. Getting the point? Now look here, there is another question, one topic from the headache. I told you the blood supply of the cranial cavity. Yes sir, there is a common carotid artery, internal carotid artery, external carotid artery, vertebral artery. If there is the abnormality in that situation, there is migraine. And remember, unilateral headache, NEET PG 2020-22, medicine integration with the anatomy. Yes, nausea, photophobia and phonophobia. Yes, this is your migraine, and drug of choice is the sumatriptan 5-HT1BD agonist. Agree everybody? Fine. Now look here. Next question, NEET PG 2021. Again question from the headache. So what I want to tell you, the question is going to ask over the headache, migraine. Yes, it is our blood supply of the brain. I told you here. Agree? Yes, sir. The blood supply of the brain. If there is the abnormality, vascular theory, neurogenic theories are given. So correlate with the anatomy. Yes, it will help. So question is, a 37-year-old woman presents with the headache. For 6 months, she has been taking analgesic. So this is the key point. The headache recently increased in severity for the 3 days, but was reduced on stopping the analgesic. तो दवाई खा रही थी, दर्द दे रहा था, दवाई बंद कर दिया, दर्द खत्म हो गया. Definitely this is medication overuse headache. Agree everybody? Fine. Yes, yes, Muthukuman, hello beta, hello. So now we are looking for the next question. I told you this topic. Yes, female patient with the negative urine pregnancy test presents to you with the galactoria. Yes, it is our galactoria amenorrhea syndrome, ops gynae. MRI was done which revealed a large pituitary tumor. Yes, sir. If patient is not willing for surgery, which of the following is the best treatment? Yes, bromocriptine. NEET PG 2022. फिर से ये क्वेश्चन आने वाला है. What I want to tell you? Yes, this is the sure short question. Pituitary tumor, two types, sir. Benign and malignant. Remember, benign is more common than malignant. Benign, that is our pituitary adenoma. Remember, this is two types. Yes, sir. Micro and macro adenoma. Okay. If less than 10 mm, microadenoma. If more than 10 mm, then macroadenoma. Sure, short question is going to ask. I had told you already that this pituitary gland is located where? Yes, sir. We had seen in our cranial cavity. Look at this part. We had seen this cranial cavity. Pituitary gland is the king sitting at the center. Okay, sir. So if it is getting enlarged, it will cause damage to the our optic nerve, optic chiasma, bullet train anatomy. Okay. Yes, sir. So pituitary gland was located at this Turkish saddle, sella turcica. If it is getting enlarged, pituitary adenoma, it will damage just on the front side, optic nerve. Agree, everybody? Fine. Definitely the question is going to ask from here. So what I want to tell you, yes, thank you, Sanjeev, thank you. Everyone is king. You are also the king. I am also the king. Okay, everyone is the king. Thank you, beta. Thank you for your positive words. Hope you all are enjoying. So what I want to tell you, microadenoma and macroadenoma. Now look here. Whenever there is a tumor, there is the damage to optic chiasma. So it will lead to the bitemporal hemianopia. Also, you can say the tubular vision. Yes, sir. This is our ophthalmology CBI, conceptual brainstorming integration. Yes, this pituitary tumor, this all you will see in medicine and pathology, conceptual brainstorming integration. Agree, everybody? Now see, physiology. If there is the pituitary tumor, which cells are getting proliferation? Sir, lactotrophs. Definitely question is going to ask, mark my point. Okay, so there is a lactotroph, so there is the increased milk. Yes, due to the increased prolactin hormone. If there is a more prolactin hormone, then it is leading to the galactoria amenorrhea syndrome. So this is your physiology. And this galactoria amenorrhea syndrome you will learn in ops gynae. So this is the ops gynae conceptual brainstorming integration. Remember, Sheehan syndrome is also very important. Galactoria amenorrhea syndrome and Sheehan syndrome you have to learn. Agree, sir? Now, if there is the increased prolactin hormone, you have to treat. So jump for the pharmacology. Yes. Again, pharma and our medicine conceptual brainstorming integration. This prolactin hormone is a dopamine antagonist. That's why you will give the dopamine agonist, that is bromocriptine. But better drug, yes, many side effects are there. That's why you will use the cabergoline. Agree, everybody? Definitely the question. Yes, goodwill. Amazing. Clapping for the goodwill. You are right, beta. But if medical treatment is fail, then what you will do? Definitely you will take the help of the surgery. So I told you which is the best approach. Answer is transnasal transsphenodal hypophysectomy surgery. Correct, Dr. Vaishnavi, Ankur, you all are right, beta. You all are right. Shihan and your PPS, this all you have to learn. Okay, so at that time, this is the very, very, very important. Okay, remember this entire part. Sure, question is going to ask from here. Sure, because approximately 6-7 subjects are integrated here. Okay, so you can see here there is the our anat, physio, patho, pharma, medicine, surgery. Many integrations are. Yes, ophthalmology. Why we are leaving the ophthalmology? Yes, why we are leaving the ops gynae? Any topic which is including the multiple subject integration, definitely damn sure question is going to ask. So mark this word. Yes, already this is the question of the NEET PG 2020-22. So I'm not saying any new thing. Agree, everybody? Fine. Okay. Yes, beta, I'm not exact correct person. My pharma knowledge is very weak, very weak. So please go for the our respected sir. He will tell you I'm just giving you the integration, beta. Sorry for this, okay? But I will look because you had asked the question. And any student, if you know, question is Anthony is asking in pregnancy bromocriptine or cabergoline, what to mark? I think cabergoline should be the answer, but I not the final. Okay, yes, yes, ENT also. Please, any student, if you are confirmed, then please write down. Otherwise, we will ask to our respected sir. Okay. Yes, yes. So this is the our point. What I want to tell you, integrate with the surgery. Yes, I told you the pituitary gland is sitting here, king is sitting here. You cannot go from here, not go from here, not from here, not. Best is from the now nose side. So how you are cutting the pituitary gland? You are going through the nose. This is our transnasal. You are breaking the sphenoid bone. Transsphenoidal. You are cutting and removing the pituitary gland. That's why hypophysectomy operation. Agree, everybody? Okay, so Ankur is saying bromocriptine. Yes, so here we are having the answer. All students are very nice. So Soham is saying bromocriptine, अंकुर इज सेइंग ब्रोमोक्रिप्टिन. तो चलिए अपने फार्मा के नॉलेज को और अपने प्रेग्नेंट और अपने मेडिसिन और साथ में ऑप्स गायनी के नॉलेज को बढ़ाते हैं. इन केस ऑफ द प्रेगनेंसी, यस, इफ देयर इज अ गैलेक्टोरिया एमेनोरिया सिंड्रोम, यस, इन दैट सिचुएशन ब्रोमोक्रिप्टिन इज सेफ. स्टूडेंट्स आर सेइंग थैंक यू बेटा, थैंक यू. नाउ yes, 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 beta, we are integrating with the anatomy. Now look here, upper limb. So we had completed the integrated pattern of the, yes, head and neck face part and our neuroanatomy part. Agree beta? We had seen the different many important question: glands, cranial nerves, cranial cavity, circle of Willis, blood supply of the brain, bleeding within the our cranial cavity, yes, pharyngeal apparatus, glands, parotid gland, submandibular gland, thyroid operations. These all are sure shot going to ask in your exam. Okay, so can we start the upper limb 360-degree integration? Okay, so now we are going to continue, but again few beautiful lines for all of you. हम इस लाइफ में चल रहे हैं, हमारे सामने एक टारगेट है, लेकिन इस टारगेट का क्या होगा, हमें मिलेगा कि नहीं मिलेगा. एक पागलपन चाहिए, एक जिद चाहिए, एक जुनून चाहिए जिसके थ्रू आप इसके पीछे लगे हुए हो. और जब आप ऐसा करते हैं, देयर विल द मेनी पर्संस हु विल से नेगेटिव कमेंट्स फॉर ऑल ऑफ यू. यू आर प्रिपेयरिंग फॉर द नीट पीजी एग्जाम एंड द मेनी पर्सन विल बी देयर हु विल से नेगेटिव. टांग खींचने वाले कोई कम नहीं होते, लेकिन आपको क्या करना है, हाथ जोड़ना है और चुपचाप निकल जाना है. रिमेंबर, जिसको जो कहना है कहने दो, अपना क्या जाता है. जिसको जो कहना है कहने दो, अपना क्या जाता है. ये वक्त की बात है और वक्त सभी का आता है. So with this very beautiful lines, we are going to start our upper limb 360-degree integration. Yes, so let's start this question. A 37-year-old patient met with the road traffic accident. Again, I want to tell you, road traffic accident is very important. Now see, due to over speed of the bike, yes, presented with the multiple fracture of the humerus done by due to the fall, he experienced that he lost the sensation over the lateral side of the forearm. This is the very big point. Remember, the lateral side of the forearm, it is supplied by the our, yes, lateral cutaneous nerve of forearm. And remember, it is nothing, it is continuation of the musculocutaneous nerve. There is the difficulty in flexion of the elbow. Why? Because biceps is not there, not working properly. And weakness of the supination. Remember, biceps is the powerful supinator. Screwing muscle is the our biceps. Okay, which nerve is most likely to the injured? Yes, answer is the musculocutaneous nerve. Agree everybody? Fine. Yes, thank you, MHD sir, thank you. So you all are getting the point. This all. Yes, I'm taking the class in English, beta. Yes, Shri Aruna Krishnan, I'm taking the class in the English, but a few times, yes, shairi, jokes, these all little in Hindi. Okay, so we are going to look for our next question. See here, lateral boundary of the anatomical snuff box. I told you, when you are extending the thumb and you are rubbing the thing and snuffing, yes, this is the snuff like, yes, box like structure in our body, in our anatomy. That's why anatomical snuff box. Yes, we had seen this anatomical snub box in our bullet train anatomy. So please go for this our anatomical snub box. Yes, at that time I told you the boundary आगे longest, पीछे longest, बीच में brevis. Anteriorly there is the abductor pollicis longus. Yes, post just behind to it abductor pollicis longus. In the between there is the extensor pollicis brevis and there is the posterior boundary extensor pollicis longus. Why it was important? Yes, we had discussed, because there are the four clinical, the wristwatch neuropathy. I told you salmon boy, आज गाड़ी तेरा भाई चलाएगा. Do you remember? Yes, he is wearing the very loose wristwatch because the radial nerve is getting compression here. So this was to the anatomical snub box. Anatomical snub box, each and every point you must remember. Go for the bullet train anatomy. Here there is a cephalic vein. We give the intravenous injection. Yes, there is the floor. These different bones are making the floor, but don't forget this is squat bone. It is the second most common bone getting the avascular necrosis. Remember, the first most common bone is our neck of the femur. Second is scaphoid bone, for which you apply the glass holding position and you make the plaster. Remember, not for the Colles fracture, the glass holding position. In this position, the thumb, the base of the our first metacarpal bone, yes, the different carpal bone and the styloid, they are coming in the align. So this is the best thing. This question had been asked in your orthopedics, that's why. And the content is the radial artery. Don't forget this our dequervant tenosynovitis, for which you perform the our Finkelstein test, orthopedics integration. No excuse from the anatomical snub box. Okay, yes, yes, mummy dummy, you are right, beta, you are perfect. The third most common bone is our, yes, talus. You are right. So we discussed about our orthopedics. So which of the following forms the lateral boundary? Lateral is our anterior boundary. Anterior boundary is formed by the our, remember, abductor pollicis longus is there and there is the extensor pollicis brevis. So just find out abductor pollicis longus and extensor pollicis brevis. So A is the answer. A is the answer. Agree? Now come here. A patient presented with the extension at the metacarpophalangeal joint and flexion of the interphalangeal joint. Yes, there was the PYQ in 90 seconds. I told you. Yes. Remember, lumbricals muscles are responsible for this pain holding position. Baba ji ka thullu position. There is a flexion at the metacarpophalangeal joint and extension at the interphalangeal joint. Which muscles are responsible? Remember, the lumbricals are responsible. So this is your answer. I told you the first and second lumbrical supplied by the median nerve, third and fourth lumbrical supplied by the ulnar nerve. So if there is a median nerve and ulnar nerve, both are getting damaged. So just do opposite. Yes, at the side of the flexion do the extension, at the side of the extension do the flexion. So this is your complete claw hand Singham. This dancing style, the best dancer of the Bollywood, Ajay Devgan Sahab. Okay, so this is the complete claw hand. But we all know that ulnar nerve is most commonly damaged. So ulnar nerve is damaged. That's why only the ulnar side is involved. So ulnar claw hand is more common than the complete claw hand. Agree? No excuse with this topic. Agree, everybody? So now we are going to look for the next, the muscle marked by the arrow in the image. So you can see this beautiful diagram. I told you at that time, whenever the cadaveric image is asked, remember the राहत इंदौरी साहब, वो बुलाती है मगर जाने का नहीं. ये नीट पीजी एग्जाम है, इधर आने का नहीं. इन द सिमिलर वे वो दिखाता है. यस, वो एरो दिखाएगा आपको कैडेवरिक इमेज में, वो दिखाता है मगर देखने का नहीं. फर्स्ट लुक above, down, medial, lateral. Look at the option. Give proper direction to your thoughts. Sorry. Give proper direction to your thoughts and then guess the answer. Sir, this is looking like the ear. So this is the neck. Yes, ear, neck. Find out the silly point for the cadaveric image. आराम से बेटा, कोई हड़बड़ी नहीं. cadaveric image आ गया तो डरना नहीं है, बहुत आसान है. Look at the option. Now look here. Yes, beta. Santhony, I will tell you the vascular supply of the heart at the last. Please recall me. Otherwise, Shanthani, beta, you can go for the bullet train anatomy. It is already uploaded. It is there in our cerebellum platform. Okay, you will get there. Okay, beta. Now see here. So you can observe this is our scapula. Yes. You can observe here the muscle which is coming from above. When this muscle will contract, it will cause elevation of the our scapula. So this is definitely levator scapulae. Can you see this another muscle? Sir, this another muscle is showing rhomboid shape, but it is small. Can you see this another muscle? Sir, this is rhomboid shape, but it is very, very big. So this is our rhomboid major. Sir, this is our, yes, rhomboid minor, and here is rhomboid major. Now see here, it is our dorsal side. Just one time, because this question had been asked. So I am showing you the three-dimensional orientation. Turn the body just like the Iron Man. Yes, it is our trapezoid shape muscle, trapezius. Can you see? This is one muscle. Do imagination, it is attached to the scapula. When this muscle, it will contract, yes, it will elevate the scapula. What should be the name? Levator scapulae. Now look here, there is another muscle. ये काजू कतली शेप का है, rhomboid शेप का है, that's why it is rhomboid. It is small, that's why minor. Can you see? This is another muscle. Yes, this is kaju katli shape, rhomboid shape. That's why rhomboid. It is big. That's why major. Agree, sir. Now try to catch this point. There is one nerve. One nerve is there which is running over the dorsal aspect of the scapular region. What should be the name? Sir, this is a dorsal side scapular running nerve. Dorsal scapular nerve. So simple. Agree? Yes, 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 yes. So now this is the answer, our dorsal scapular nerve. थैंक यू डॉक्टर वैष्णवी, थैंक यू फॉर योर सो ब्यूटीफुल लाइन्स. देखो बेटा, होता क्या है, एवरी टीचर इज बेस्ट, एवरी स्टूडेंट इज बेस्ट. होता क्या है कि एक टीचर होता है, एक स्टूडेंट होता है. एक स्टूडेंट को एक टीचर की बोलने की कला जो है वो अच्छी लग जाती है, उसका पढ़ाने का स्टाइल अच्छा लग जाता है, ट्यूनिंग जम जाती है और रेजोनेंस हो जाता है. एवरी टीचर इज बेस्ट, एवरी स्टूडेंट इज बेस्ट. आप मेरे लिए बेस्ट हो, मैं आपके लिए बेस्ट हूं, क्योंकि आपको मेरा बोलना, मेरा पढ़ाना अच्छा लग रहा है और आप मेरी बात समझ रहे हैं, इसलिए आपका साथ मुझे अच्छा लग रहा है. तो इसलिए हम दोनों मिल करके बेस्ट हो जा रहे हैं. व्हाट आई वांट टू टेल यू, एवरी टीचर, एवरी बुक, एवरी इंस्टीट्यूट इज बेस्ट. वी ऑल आर गिविंग द गाइडेंस फॉर ऑल ऑफ यू. बस आपको ये खोजना है कि आपकी पढ़ाई लिखाई कहां पर आसानी से हो रही है. एंड आई वांट टू टेल यू दैट माय ब्यूटीफुल सेरिबेलम academic team, it is loaded with the amazing kind of the teacher in our WhatsApp group. Every day we are talking about you all the students कि कैसे हम आप लोगों के लिए और अच्छा कर सकते हैं. So definitely you all will enjoy this all the things. Okay, thank you very much beta, thank you. Fine, so we are continuing this all the points. Yes, come to this point. See here the question is our nerve supply of the area marked by the arrow in the image. So you can see I told you the story on the dorsal side. Sir, this is our half and half area. Few books they are saying about the, yes, remember there is one more thing, that 3.5. But this is our radial nerve area. Radial nerve is coming from the anatomical snub box part. Okay, sir. And from the ulna side there is the our nerve. Which nerve? Ulnar nerve. Dermatome. Remember one topic from the dermatome. Very most important. Agree beta? Fine. So now we are going to look, there is the one point, but median nerve they are supplying the front side 3.5. So this median nerve is coming from the front and supplying the nail bed. Yes, median nerve is coming and supplying the nail bed. So this nail bed, this nail bed, this nail bed and this nail bed up to the lateral side, yes, it is supplied by the median nerve. Nail beds they are supplied by the median nerve. Okay, lateral 3.5. Oh, sorry. Yes, so these are our median nerve. Here, this is the area supplied by the ulnar nerve. So, can you tell me which is the best finger for the sensory examination? Yes, what I am going to ask, best finger for what? Sensory and motor examination. Remember, motor examination, best finger for the motor means which finger is having all the nerve supply? Answer is the thumb, because here is the adductor pollicis supplied by the ulnar nerve. Yes, it is doing the flexion with the help of the median nerve, and there is our radial nerve which is doing the extension. So the best finger for the motor activity, thumb. Yes, when you are going to perform any exam, what I will do, I will say all the best. Motor अपना काम अच्छे से करो, all the best, so you can remember. And which is the best finger for the sensory examination, which is having all the three nerves? See here, sir, this is our median nerve, but here is radial nerve, and this is the ulnar nerve. So you can remember with this funny trick. Yes, this is the middle finger, which you can remember easily. This is the best finger for the sensory examination. For the motor examination, all the best. For the sensory examination, middle finger. Getting the point? So just one funny way so that you can not forget. बेटा सबसे पहली चीज concept होती है. I told you the concept, but the tricks, mnemonics, they help to produce the answer quickly, which will save the time. Every second is important during the exam. Agree? So now, yes, you are right, beta. Anshul, there is the, I told you the dermatome C5 and C6, then C7 and then C8. So C6 for the thumb. You are right, Anshul, you are right. Yes, Dr. Rao, you are right, beta. Now come to the our next question. Which of the following is true regarding the dequervant tenosynovitis? Yes, it is. Fingers are held in the mid extension, it affects the abductor. It is asking the true, na? Fine. So it affects the abductor pollicis longus and extensor pollicis brevis. Most common involvement is the index finger and treatment is the surgery. Tell me, what is your answer? What is your answer? Yes. Yes, Anthony, you are right, beta. Middle finger is C1. This is the dermatome. Yes, there is a lots of variation, but go with the Harrison. This all. Yes. So here is the correct answer. Dark night. You are right, beta. Okay. Now come to the next. What is the function of the muscle? PYQ. We had seen. You can observe. This is the muscle which is above. Then one another muscle which is below. Okay, tendons are there, and you can see these are unidirectional muscles. You all are aware, so you can easily learn. This is superficial flexor, it is going to the digits, digitorum superficialis. Yes, this is the flexor going to the digit, but at the deep profundus. So these are your diagrammatic presentation, and definitely this is our lumbrical. This short intrinsic muscle very most important for the NEET PG 2023 because it is related with the claw hand. So remember, these are responsible for the pain holding position. So metacarpophalangeal joint, I told you, sir, these are responsible for the flexion. Perfect. Hope you all are getting the point. Fine. Now, correct, Sai Anthony, you are right, beta. See here our next question. Anatomy question we had seen. Now we are looking for the integration. Surgery NEET PG 2020-22. Definitely one question. Again, I want to tell you the breast, hernia and thyroid. So don't leave this topic from the surgery. Okay? Why? You can see the breast cancer. Definitely this is our POD orange appearance which occurs, okay, in our breast carcinoma. Okay, this is the POD orange appearance. Don't forget it. So what is the cause for the following skin change? Remember, option was given an infiltration of the subdermal lymphatic. Why you have to remember? In anatomy, lymphatic drainage of breast you study. This is the anatomy and that is the surgery. So you have to integrate properly. Fine. So don't forget it. Okay. Now, yes, code blue, you are right. FMG January 2023. Same topics will be asked because both are getting fused and becoming the common exam. That is our next. Come to the next. Can you see? Surgery NEET PG 2021. Again, you can see the breast carcinoma. So, breast carcinoma in 2021, then breast carcinoma in 2022. Definitely it is going to ask in your 2023. Don't leave this breast, hernia, thyroid. What is your most likely diagnosis? So here was the our answer, lymphedema. This is the part you have to see in the surgery. I'm just telling you the anatomy and surgery integration. Can you see here? This another question. Yes, you can see which of the following is true about the flap given in the image. So there is the again breast carcinoma surgery. You are taking the flap from the our abdomen part. Here is the our muscle. Which muscle? Rectus femoris. Rectus abdominis. Can you see the muscles of the abdomen? Yes, sir. External oblique, remove it. Can you see? Internal oblique, remove it. Can you see this muscle? Sir, this is straight running muscle in the abdomen. So this is the rectus abdominis, which is presenting the tendinous intersection. Yes, there is the our tendinous intersection which is making partition. Agree everybody? So you are able to see that there is a one artery presenting here, that is the deep inferior epigastric artery. You will cut this portion and you will apply here. So remember, this is our deep inferior epigastric artery posterior perforator flap. So here is our artery, you can observe beautifully, sir. This is our perforator artery. So this part you will cut from the anterior superior iliac spine and you are applying. So this is the anatomy and your surgery integration, go for it. Now see here, what is the most common complication of this condition if left untreated? So you can see, apply your anatomy. You can see here, sir, this is our radius and here you can see the ulna. Okay, getting the point? Fine. Yes, radial tuberosity part is seen. So there is a fracture. So there is a question, most common complication if there is the fracture. Yes, you will see there is the cubitus valgus. So orthopedics integration with our, yes, this is our portion of the orthopedics. Okay, now see, there is a orthopedics NEET PG 2022. So you all are aware that questions are asked from the fat embolism. Remember, there is the our any kind of the bone. Yes sir, there is the our cortex at the peripheral part and within the medullary cavity there are our connective tissue, blood vessels, this all. Also remember, the bone marrow cavity, there is the 50% fat. So when there is fracture, yes, whenever there is a fracture, it is going into the our blood vessel and it is causing the embolism. It is reaching to the our pulmonary circulation and it is causing the difficulty in breathing. So no excuse with this fat embolism. Agree? So this is the question. A male patient presented with the bone fracture following road traffic accident. After 2 days, he developed dyspnea, pathology involving the whole blood, fall in oxygen saturation. What is likely diagnosis? No excuse. Yes, with the plate at the platform of the anatomy you can do. Now see another question. Orthopedics NEET PG 2022 integrating with the anatomy. It is given in anatomy also. A boy falls on the left shoulder joint. The first chapter in the upper limb, the first bone, clavicle. Okay, emergency department with shoulder. His left elbow is flexed. Okay, and supported by the right hand. So this position is adopted. Yes, elbow is flexed and supported by the another hand. Okay, fine. So left elbow. It is talking about the left elbow. Okay, which bone might be most likely fractured? So remember, in this situation, the most common bone which is getting fractured, that is clavicle. So clavicle is the answer. Now I told you this NEET PG 2018. Yes, anatomical snuff box. Getting the point? Yes sir, anatomical snuff box. It is very important point. Anatomical snuff box, NEET PG 2018. Extensor pollicis brevis and abductor pollicis longus, these are making the boundary of the our, yes, anatomical snuff box. So if there is an excessive use, the synovial sheath of this tendon, they are getting inflamed and there is the problem. So remember, this is our anatomical snuff box. There is the inflammation, these tendons are involved. This is our dequerventinosynovitis. Agree? And how you will test? Yes, you will ask the person to flex the thumb in this way and just do movement in this way away from the radius. So there is the pain over the anatomical snuff box, means there is the dequerventinosynovitis. Diagnosis is confirmed. Agree everybody? Now look here. Yes, you are right, Dr. Reformer. You have to see for the Alman classification. Fine. Now look here. Orthopedics NEET PG 2020 question. Which of the following is not associated with the Sprengel's deformity? Yes, when there was the movie Pushpa. Okay, jokega nahi sala. You all know there was the high shoulder one side and another is in this way. So this is congenital high position of the scapula. You can go at the Facebook and you can search. This was the one famous image from my Facebook profile. Okay, so this is the our very good point, and this question had been asked in your orthopedics 2020. This is known as the Sprengel's deformity. Remember that our Dextrocardia is not present. Yes, dextrocardia is not present. Opposite side heart, right side heart is not present, but it is having the our diastropomyelia. Yes, Klippel-Feil syndrome, congenital scoliosis, this all are present. Agree, beta? So don't forget it. Now see here, question. A maid is playing with a child by spinning him while holding his hand. A few hours later, the child starts crying, does not use his arm and does not let anybody touch him. What is the possible diagnosis? So it is very common condition in homes. क्या होता है कि बच्चे को पकड़ लेते हैं और गोल गोल घूमते हैं, गोल गोल रानी, इतना इतना पानी, something like that we are, and in that situation the elbow joint, it is getting dislocated. Yes, this is nothing, it is our pulled elbow. It is not only given in the orthopedics, but it is given in the BD Chaurasia sir also, in Gray's Anatomy also, Vishram Singh sir Anatomy also. So this is the classical case of the pulled elbow. So whatever the topic which are getting overlap, they are going to ask in your exam. Now see here, there is a question. A 30-year-old male patient presented with the complaint of the gradually progressive swelling around the wrist joint for the 3 months. And can you see the X-ray film? What is your diagnosis? So there is the our lower end of the radius is involved, soap bubble appearance. So definitely your answer is osteoclastoma, you can say giant cell tumor. So what I want to tell you, in your orthopedics, definitely the question from the bone tumor is going to ask. Okay, and at that part you have to use the knowledge of the anatomy, osteology you have to use, radiology knowledge you have to use. So you have to use the ortho and yes, radiology integration. Now look here, after this there was one more question, but I think that is the in our lower limb part. So we are going to look for the our lower limb 360-degree integration. Agree everybody? So we are going to start this our lower limb integration, but lines for all of you. Again remember, जिंदगी मिली है तो कुछ बन के दिखाऊंगा, आज वक्त खराब है तो क्या हुआ जनाब, कल बदल कर दिखलाऊंगा. सो रिमेंबर, आने वाला वक्त, आने वाला दौर आपका है. यू विल क्रैक एवरीथिंग. जस्ट अपने आप ऊपर भरोसा रखिए. ये मैटर नहीं करता कि हमने ज्यादा पढ़ा या कम पढ़ा है, घबराना नहीं है. Agree everybody? So now we are going to look for this next question. Yes, lower limb 360-degree integration. Look here, a patient who underwent varicose vein surgery. What I want to tell you, yes, arterial disease, venous disease. NEET PG 2023. Sure question is going to ask arterial disease like the peripheral vascular disease, blockage of the artery, venous disease like the varicose vein and our deep venous thrombosis. Definitely beta ye aana hi hai ye topic. When you will do analysis of the previous year question, you will see this all the question had been already asked. So just see here, a patient who underwent varicose vein surgical treatment now presents with the loss of sensation in the medial leg. Which of the following is injured in this patient? I told you at that time, yes, we had drawn the medial malleus, lateral malleus, and there was the foot, great toe and other toes. This is very important, and for the interest we just used the our yes nail polish. So this is our foot. Remember, there is our nerve, there is the vein, medial marginal vein, lateral marginal vein. Here is a dorsal venous arch. So medial end of the dorsal venous arch, it was fusing and running with on the front side of the medial malleolus. Yes sir, this was nothing, it was our great saphenous vein, and this is union of the lateral marginal vein with the lateral end of the dorsal venous arch. Sir, this is the short saphenous vein, and it is going upside, it is going at the back side. I told you at that time, no excuse with this nerve which is closely related with the our great saphenous vein. Sir, there is a one another vein. Yes, there is another nerve which is related with the short saphenous vein. Yes, this is very very important. Sir, this is our saphenous nerve, and here is our yes sural nerve. So whenever you are doing the treatment for the hemochromatosis, that is our yes phlebotomy. Yes, remember hemochromatosis, you are cutting the vein. Also for the coronary artery bypass grafting, very very important, both are important, hemochromatosis and coronary artery bypass grafting. When you are cutting these structures, then saphenous nerve is getting damaged. This question had been asked in your NEET PG 2021-22. Now get ready for the 23. Okay, I'm not saying same question will be asked, but this topic will be asked, this dermatome will be asked. Okay, yes, here if there is a damage, if you are cutting the short saphenous vein, sural nerve will get damaged. Remember the dermatome, this first web space, sir, it is supplied by the deep peroneal nerve. And remember the lateral border of the foot, sir, it is supplied by the sural nerve, very important. And remaining all the part, yes, it is supplied by our sapana nerve. Do you remember? Sapana, superficial peroneal nerve. So don't forget this dermatome. Yes, if you want to write down in the letters, then you will show the L4, L5 and S1. No excuse. Question is going to ask. Agree everybody? This is very very important point. Yes, you all are listening right now. 174 students are here. We are very close to the exam, but you all are giving your time to me. And remember, it is my promise, I will not waste your time. ये सारी चीजें जिस दिन एग्जाम होगा हम इस पीडीएफ को देखेंगे, अपने बुलेट ट्रेन नोट में को देखेंगे. More than 100 topics will be covered definitely. Okay, so thank you very much for giving the time. My clappings for all of you, my thumbs up for all of you, my fire, my heart, my everything is for all of you. Okay, so we are going to look for the next question. You can see here which nerve is getting damaged, sir. Saphenous nerve. Again there is our coronary artery bypass grafting. Saphenous vein graft was taken during surgery. Yes, the saphenous vein was removed. What complication can occur? Again answer is the saphenous nerve. So you can see the NEET PG 2022, NEET PG 2021. So get ready for the NEET PG 2023 also. Agree beta? Yes, goodwill. Thank you beta. Thank you. Rakesh, you are right beta. Yes, yes, yes. And definitely you will crack. We all the teachers, yes, your parents, the God, all are with you. जो कोशिशें करता है उसके साथ पूरी कायनात होती है. तो आप कोशिश करते रहिए, बिल्कुल बेटा आप सक्सेसफुल होंगे. वी ऑल आर विथ यू. ओके, yes, yes. No beta, superficial peroneal nerve. Santhani is asking SPN, सपना. Do you remember? हम last time पढ़ रहे थे सपना, तो किसी ने कमेंट किया था सपना चौधरी. Okay, so this is our superficial peroneal nerve, sapana. It is the nerve of the lateral compartment, but its cutaneous branch is running over the dorsum of the foot. Okay, now come to the next, foot drop. सर ये तो बहुत आसान क्वेश्चन है. Foot is going downside, that is a foot drop. The best answer is our common peroneal nerve. I am showing you the three-dimensional way. See here the our fibula. Look here. We had seen the lower limb, turning it. The thickest nerve of the body, sir, that is a sciatic nerve. Sciatic nerve is coming down, coming down, coming down, and it is dividing into the tibial nerve. Yes, it is a tibial nerve, nerve of the posterior compartment. But there is a one more division. Yes, sir. This is our common peroneal nerve. Can you see? Yes, it is our common peroneal nerve which is running close to our fibula. Yes, sir. Here is our head of the fibula, and this narrow constricted part of the fibula just below the head is neck. Which nerve is related to the neck of the fibula? Answer is common peroneal nerve. So when there is the road vehicle injury, gaadi eye, dashboard, car dashboard injury, so this is getting fracture. Common peroneal nerve is getting damaged. This common peroneal nerve, yes, it is dividing into the our deep peroneal nerve. This common peroneal nerve is dividing into the our deep peroneal nerve, which is the nerve of the anterior compartment. Can you see? This is the deep peroneal nerve. So it is supplying all the muscles of the extensor compartment. So it is responsible for the elevation of the foot. If there is a damage to the common peroneal nerve, deep peroneal nerve has gone, so foot cannot be elevated, it will go down. So that is the foot drop. Foot drop due to the common peroneal nerve, best answer. If not given, then you can mark the our deep peroneal nerve also. And remember one more thing, that our wrist drop due to the radial nerve injury. Don't forget this all, ortho anatomy integration. Agree everybody? So now we are going to look for the our more question. Yes, you can see a male patient presents with impotency and bilateral resting pain, and you can see there is the gangrene. So I told you the arterial supply of the lower limb. So just try to catch this point. Sir, we had learned this arterial supply, anterior superior iliac spine was there, pubic tubercle, pubic crest, pubic symphysis, and here was our, yes, ligament, inguinal ligament. Yes, yes, you are right, Dr. Reformer, you are right, better Lerich syndrome. So there was the our lower limb part. Yes, sir. And we had seen the leg, medial malleus, lateral malleus, foot. Don't forget it. Yes, nails with the nail polish. So just to try to understand the arterial supply. Yes, sir, there is the abdominal aorta. It is dividing into the right and left common iliac artery, internal and external iliac artery. This external iliac artery is continuing in the femoral triangle as the femoral artery, and then it is winding backside and reaching into the popliteal fossa, popliteal artery, and then it is dividing into the our anterior tibial artery and the posterior tibial artery. The anterior tibial artery, it is running over the dorsum of the foot, dorsalis pedis artery, and there is the our, yes, arcuate artery also. Agree? So these are the our arterial supply. In this question it is writing there is the impotency. Why impotency? Because this particular internal iliac artery is not working and there is a gangrene of the foot. So definitely this external iliac artery, yes, external iliac artery, femoral artery, popliteal artery, and you can remember the anterior tibial artery, and here is our posterior tibial artery, and this is most important, dorsalis pedis artery. So here both are involved. So definitely there is the blockage in this part. Yes, you can say the common iliac artery, but see here common iliac artery is given. Yes, in our option common iliac artery was not given, so you will say there is a junction between the aorta and the iliac. So this is our aorto-iliac junction. Here is the blockage due to any cause, atherosclerosis or embolism, whatever. Fine. So that's why this is your question. This is our aorto-iliac bifurcation integrating with the surgery. This is Lerich syndrome, male patient with impotency. This is the, he is presenting with the bilateral resting pain. Agree everybody? So this is important. Fine. So go with this. This is very, very important for your NEET PG 2023. On its basis, you can solve the arterial disease. You can solve the peripheral vascular disease. Agree? Yes. Now, look here. The next question, same. NEET 2020, you can observe 50-year-old male who is chronic smoker presented to the hospital with the intermittent claudication, pain of the both thigh and buttock region on walking about 500 meter. Which of the following is likely diagnosis? Again, arterial disease with the aorto-iliac involvement. What I want to tell you, see here, NEET PG 2020, okay sir, and NEET PG 2022, arterial disease has been asked, so don't leave this topic. Agree? So now we are going to look for the another NEET PG 2021. Oh my god, sure this question is going to ask. Again, arterial supply. What I want to tell you, yes, arterial disease, NEET PG 2020, then NEET PG 2021, then NEET PG 2022, as well as your saphenous nerve, venous drainage. Yes, it had been asked in 2021 and NEET PG 2022. So it is going to ask in the NEET PG 2023 both. Yes, you can guess 80% chances. Sometimes maybe not us, but yes, you cannot take the risk with this arterial disease and the venous disease. These topic you will study on the platform of the anatomy. Look here, this is our anat, surgery, radio, conceptual brainstorming integration. Yes, a 70-year-old female patient. Yes, Anthony, if pain in calf, then interiliac artery or external. If pain in calf means lower limb is supplied by external iliac artery, getting the point, Anthony? Okay, external iliac artery, and this external iliac artery will make the femoral artery anteritibial posterior. Calf area is posterior side. Yes, it is supplied by, remember, it is supplied by the posterior tibial artery. So answer will be external iliac. Yes, Dr. Vaishnavi, very good beta. Share the knowledge, you are right. Yes, Selva Kumar, thank you beta, thank you. Now come to the next. Yes, here. Thigh during walking. Investigation reveal the following finding as given below. What will be your answer? So just observe. Can you see? This is our common iliac artery. Yes, aorta. And right and left side it is dividing. And can you see it is dividing into the external iliac, so on. But here is the no continuity of the dye. So definitely there is the blockage. Getting the point? So this, what you will use? You will use the aortofemoral bypass. Yes, you will make the bypass between the aorta and the femoral artery. Agree beta? Getting the point? Yes, God bless you beta, Anthony. We will get very happy when you will get selection. And remember, if you are getting the success, then story is not ending. कहानी तो बेटा तब शुरू होगी. एंड समटाइम्स स्टूडेंट्स दे आर गेटिंग द फेलियर, बट रिमेंबर, फेलियर इज नॉट द फैटल. कोशिशें जो करता रहता है वही आगे बढ़ता है. जो सोचता है कि हाँ अब मैं सक्सेस पा गया, अब सब चीज मैं जान गया, कहानी खत्म हो जाती है. कोशिशें करते रहना, चाहे जीत हो चाहे हार हो, कोशिशें करते रहना, यही इंसान की परिभाषा है. याद रखिए, मानव जब जोर लगाता है पत्थर पानी बन जाता है. So this is our beautiful integration. Now again, can you see the NEET PG 2021 question? Yes sir, there is our tortuous zigzag dilated veins. So this is typical varicose vein condition. You can observe according to the CEAP classification, what is the C stage in this patient. So definitely you have to study the C stage in your surgery. This all the PDF you will get, go for the surgery. Okay, but yes, varicose vein, so venous drainage of the lower limb is important. I taught you all the great saphenous vein, short saphenous vein in our bullet train anatomy part. Okay, so now come to our next question. Again, see here, this is the question pattern from the surgery NEET PG 2022. So we are looking the arterial disease anatomy. Yes, this is your surgery, and here is your, yes, radiology. Always remember, patient presents with the sudden onset right leg pain. Investigation was done and obtained image is shown. So can you see this all images beautifully? You can observe. Yes, what is the investigation? Definitely for the arterial disease you will do the ultrasound Doppler. So remember, yes, Goodwill, even though I don't know Hindi the way. Yes, thank you, Goodwill. I'm using the maximum words from the English. Okay, I'm using maximum words from the English. 90% is English, only the 10%, the shairi, the jokes, these all are in Hindi. Okay, so yes, definitely many students, for us they are from the our south side, and I am taking the many classes for the Hyderabad, for the Chennai. Yes, my first PG class at the Kochi and our lovely Ahmedabad BJMC Medical College. So I always remember this, all our lovely South Indian students as well as the Gujarati students. Okay, so now see here the Doppler process you will learn in your radiology. You are putting the probe and you are looking the effect, the sound effect. Yes, sound is coming, hitting, and it is getting reflect. No radiation problem is there. So this is the best thing for our arterial disease. Okay, now come to the next question. Again, surgery NEET 2022. A patient presents with the tender pulsatile mass shown in the neck. So can you see this one? Okay, what will be the next step? Definitely again it is the arterial disease, so ultrasound Doppler. So can you see NEET PG 2022, and this question had been asked in your NEET PG 2022 ultrasound 2 times in the NEET PG 2022. So this is again very important for the NEET 2023. Yes, this ultrasound Doppler is very important for the NEET PG 2023. Agree beta? Fine. Yes. Hope you all are getting the point. Yes, Medha, you are right, beta. Yes, Dr. Reformer, you are right. Now, look here, the radiology integration, NEET 2021, there was a CT MRI, and we are integrating with the radiology. Yes, integrating with the our anatomy. Getting the point? Look here, the question: a 15-year-old patient with history of the spinal tuberculosis. Again, I want to tell you one question from the TB or leprosy and hepatitis, COVID, yes, jaundice part, liver failure, these all are very commonly seen. So questions are going to ask, you can guess the questions, okay? Yes, brought to the hospital with low grade fever, TB is there, low grade fever, dull backache and persistent flexion. Why there is a flexion? Yes, see here, hip joint motion was limited and painful. So this is nothing, it is our Pott's spine case, orthopedics integration. So you can see there is the one muscle related to the our spine. Yes, this muscle is taking origin from the L1, L2, L3, L4, L5, and it is going towards the, yes, our floor of the femoral triangle. This is our iliac bone. So this is our iliacus muscle. Both are combining together, and these are making the iliopsoas muscle. Do you remember the floor of the femoral triangle? I told you the mnemonic APPI. Yes, sir. A for adductor longus, P for our psoas major. Yes, P for pectineus, P for psoas major, and I for iliacus. So remember, these two muscles are uniting together and making the iliopsoas. So whenever there is the Pott's spine, there is the our pus collection, and through the psoas bursa, it is coming to the femoral triangle, and it is affecting the our hip joint. Yes, sir, it is affecting the our hip joint. So hip flexion is affected. Hip flexion affected. Yes, anatomy is easy. Now integrate the same thing with the our radiology. Yes, 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 see here the radiology part. Just integrate this portion with the radiology. Can you see the lumbar vertebra? Yes, sir, here is our iliacus muscle. Yes, iliacus, iliac bone. Yes, sir, you can see the head of femur, and you can see the kidney also. Yes, sir, kidney is visible. So you can observe one muscle is related close to the vertebra. So this is nothing, this is our psoas major muscle. Agree everybody, this is our psoas major muscle. Yes, yes, Dr. MHD sir, thank you, thank you, sir, thank you. Thank you so much. Your classes were awesome. Yes, your slides were very beautiful. Your integration was very beautiful. And yes, you are very, very, very nice singer. So we all the team are having the beautiful teachers. We all are having the amazing students. Okay. So few lines when I'm looking the MHD sir, then just a few lines. Yes, so that we can enjoy the. We are welcoming to Dr. MHD sir. Okay. मेरे हाथों की गर्मी से पिघल जाएंगी जंजीरें, मेरे कदमों की आहट से बदल जाएंगी तकदीरें, दिए उम्मीद के लेकर, दिए उम्मीद के लेकर, नीट पीजी तेरे लिए लेकर. यस, आई एम यूजिंग द नीट पीजी वर्ड. दिए उम्मीद के लेकर, ये सब तेरे लिए लेकर, जिंदगी आ रहा हूँ मैं. सो रिमेंबर दिस ब्यूटीफुल लाइन्स. यस, हम अपने दिलों में उम्मीदें लिए हुए हैं, सपने लिए हुए हैं, और इनको लेते हुए हम अपने जिंदगी के लिए, अपने नीट पीजी एग्जाम के लिए आगे बढ़ते हुए चले जा रहे हैं. यस, so beautiful team is here. So I'm also getting the stimulation. Yes, our Anand sir is so energetic, so beautiful singer. So our MHD sir is so beautiful singer. So I'm also just having few little singer property. Okay, so thank you very much. Okay, yes, 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 thank you Dr. Vaishnavi, Ankur, Ansar, Hitesh, thank you, thank you, thank you. So yes, let's continue. So can you see? Yes, psoas major muscle. And can you focus here for one muscle which is coming from the our iliac bone? Yes, sir, this is our iliacus. So this psoas major and iliacus both are uniting together and making the iliopsoas. Yes, sir, here is our iliopsoas. And definitely if there is the Pott's spine, yes, if there is a Pott's spine, this infection will go to the our hip joint. Getting the point, beta? Fine. So this is our pus pathway. Yes, yes. Thank you, Christy. Thank you, thank you, thank you. Yes, yes, Dr. MSD. We will play the Antakshari. Okay, okay. Fine. Thank you, sir. Thank you. Definitely. At Insta, we will organize this Antakshari program. Okay. So now see here, this is our sauce abscess, collection of the pus in the ileosac compartment. Okay. Retroperitoneal. I told you the peritoneum is important. Not directly, but its knowledge will be used in your surgery. Yes, you will see the peritonitis. So this sauce muscle, these are located at the back side. Okay, so these are passing through this. Okay, yes, I told you. Now come to the here. डॉक रॉन बीजेपी के फैन लग रहे हो. Yes dear, I am very far from the politics. Okay, I am having very less knowledge of the politics, but okay, fine, this is good color, that's why you are saying. Fine, thank you for your. Yes, we shall overcome, sir. Mhm. Yes, thank you, Raghu. You are my fan. I'm also the fan of you. Every student you all are supporting. So I'm very happy for all of you. Okay, and definitely we all the teachers are wishing for all of you for the great selection in your NEET PG exam. Now look here. Actually, this is the question of the NEET 2020, but I already taught in the 2018. See here, the beautiful question, very beautiful question. Appearance of the ultrasonography at the saphenofemoral junction. Yes, the junction saphenous opening is there and the femoral vein arteries are coming, showing common femoral vein, common femoral artery and great saphenous vein. It is our Mickey Mouse sign. Yes, do you remember in our last session bullet train anatomy, at that time I taught you all the, yes, this peritoneum topic. Sorry, I taught you all the peritoneum topic. So just recall. Yes, I taught you the peritoneum topic. Yes, different ligaments, epiploic foramen. Fine. At that time, I told you the free margin of laser momentum. Here are the different structures which just appears like the Mickey Mouse. Bullet train anatomy we had already discussed. So at the time of the ultrasonography, you are getting the Mickey Mouse sign in our portal triad. Getting the point? Same thing. You will see the Mickey Mouse sign. This is beautiful in art, radio, surgery, as well as medicine. Conceptual brainstorming integration. Remember this diagnosis. Question had been asked. This is seen in case of the portal triad hypertension. Yes, midbrain of the progressive supranuclear palsy. Also the polyostotic Puckett's disease. And there is a pelvic Mickey Mouse sign, inguinal vesical hernia, dysmorphic Mickey Mouse sign of the RBC and uretropelvic junction obstruction. So this is the table. The PDF will be available. The Mickey Mouse sign you can see in our portal hypertension. Look at this part. Yes, sir. Exactly like the face of the Mickey Mouse. Beautifully you can see. I told you the epiploic foramen. This all. So this is our Mickey Mouse sign in case of the portal hypertension. Yes, this is our radiology of the progressive supranuclear palsy. You will see the face of the Mickey Mouse at the midbrain side. So this is just beautiful integration. We had seen the CT MRI of the brain integrating with the anatomy and the radiology. And here you can see the Mickey Mouse sign had been asked. Okay. Now you can see this is another our, yes, you can see the femoral vein is coming near the saphenous junction where there is the femoral artery and the great saphenous vein, it is opening into the femoral vein. So here again there is the appearance like the Mickey Mouse. Getting the point? Okay, sir. So there are the different signs you will see in the radiology, and these signs are important for the NEET PG 2023. Agree? So I'm erasing this one, but these signs are important radiology now. So you have to see there. NEET PG 2023. Agree? Now look here. Yes. See here. This is the question from the orthopedics NEET PG 2000. I think this was the 2020 little problem in this PDF preparation. Yes. A 30-year-old woman developed a tumor at the knee joint. Agree, sir. Biopsy image is shown. What is your most likely diagnosis? So you can see here is the biopsy, sir. This is our histology and pathology. Histo means anatomy, pathology, and ortho, conceptual brainstorming integration. You can see beautifully the cells which are having the multinuclear, yes, multinucleated appearance. So these are multinucleated giant cell. So definitely it is the giant cell tumor. So any topic which is showing the integration, what I want to tell you, no excuse with the bone tumor. Agree everybody? Fine. Yes, yes. Dr. WHO Strange, Doctor Who Strange, you are right. Triphasic pattern was there. Okay. Yes, thank you, Raghu. Thank you, beta. Varicose vein. Yes, Mohammed, you are right, beta. Yes, yes, thank you, thank you. So these are our point. GCT, Medha, you are right, beta. Anjali, you are right, beta. GCT. Okay. Now come to our next. Now we are going to rotate the thorax 360-degree. Okay. So just to give me the few time, remember always drink the water in the copper. Okay, yes, because copper is very good for the health. Biochemistry, it is acting like our, yes, prosthetic factor, coenzyme, this all you know. So copper is very, but if there is the excessive copper overload, बड़ा है तो बेहतर है. Okay, so what you have to remember, copper excessive load, then there is a Wilson disease. Don't forget the Wilson disease and our hemochromatosis. What I want to tell you, the Wilson's disease and iron overload important. And also I told you that sun create problem. Definitely any one kind of the sun, like the Parkinson, like the Jacobson, like your, yes, Morrison, like your Simpson. This all question had been asked. Son creates problem, daughter never creates problem. So son is going to ask in your exam. So these are very most important topic. Don't forget it. Okay. So now we are going to look. Yes, yes, MHD sir, you are right, sir. So now we are going to look for the next question. Thorax integration. All of the following are true about the right coronary artery. Tell me, right coronary artery, what is all are true except. So options are, you can see, yes, its diameter is less than left coronary artery. Option 1, it arises from the anterior aortic sinus. Option 2, except, it is asking except, it gives rise to the circumflex coronary artery. Sir, circumflex coronary artery, it is the branch of the left coronary artery. So don't think here and there, mark this one. In the thorax, definitely you have to study the artery of heart. If directly question is not going asked, even then for the angina MI, the question will be asked. Remember, this angina MI is the most common cause of the death in the world. That's why you have to study. Okay, sir. So this is your answer C. You all are right. Answer Sanjeet, Anand. Yes, you all are perfect, beta. Now look here. What does give the barium swallow? So this is our beautiful integration with the radiology, anatomy, ENT. Also, you will see this topic in surgery and medicine. Yes, you can see the esophagus. Yes, here is a narrow, but at the backside there is a large pouch. It is nothing, it is our, yes, Jenker's diverticula. Also, you can say pharyngeal pouch. Yes, see here, this is our trachea. Here is the esophagus. Remember, trachea is on the front, then esophagus. I told you earlier, VOT. Yes, V for vertebra, then esophagus, then trachea. This relation is posterior to the front side. I told you, तुम मुझे वोट दो, मैं तुम्हें बर्बादी दूंगा. Yes, today's politician, they are saying vote. So remember this mnemonic. Yes, तुम मुझे खून दो, मैं तुम्हें आजादी दूंगा. नेताजी सुभाष चंद्र बोस. The old politician, they were saying such kind of the word, but nowadays they are saying vote, VOT, V for vertebra, O for esophagus, T for trachea. Don't forget this sequence. Trachea is at the front, esophagus is behind, and most behind is the vertebra. And you can see there is our muscle, upside muscle, these are obliquely arranged, but downside muscle, yes, 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 you can see these are horizontally arranged. So there is the outpouching of the mucosa. Yes, there is the one triangular weak area, this is known as Killian's dehiscence. So there is the outpouching of the mucosa known as Janker's diverticula, for which you perform the Dhol man's procedure. सो रिमेंबर दिस ढोल मैन प्रोसीजर, ढोल वाला आदमी ढोल बजाता है और इस हमारे मसल को मक्रिकोमायोटोमी, यस, इसको कट कर जाता है. सो रिमेंबर दिस वन. ओके, यस 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 आनंद, यू आर राइट बेटा. ढोल मैन प्रोसीजर, परफेक्ट. दिस ढोल मैन प्रोसीजर हैड बीन आस्क्ड. कैन यू सी दिस आउट पाउचिंग ऑफ द म्यूकोजा? नाउ लुक हियर फॉर द मोर इंटीग्रेशन. यस, NEET PG 2020, a middle-aged man presented to the emergency department with upper abdominal pain. Abdomen में ऊपर में दर्द हो रहा है. Yes, having a heavy meal. On clinical examination, upper abdominal tenderness was noted. Yes, chest radiograph showing the widening of the mediastinum. So this is the word, widening of the mediastinum. Mediastinum, the space in between the two pleura, interpleural space, is known as mediastinum. Yes, pneumomediastinum was seen. What is your diagnosis? So remember, spontaneous rupture of the esophagus and its constriction. I told you in our bullet train anatomy part, definitely you have to learn the esophagus topic, its constriction, its rupture, Mallory Wistier and the Boerhaave syndrome. You must learn about the achalasia cardia esophageal carcinoma. Sure short one question is going to ask from the esophagus. Yes, Ashish, you are right, beta. Getting the point, everybody? Now look here. This another question. A patient presents with the acute onset severe abdominal pain. He is hemodynamically stable. A chest x-ray is shown below. What is the next step management? Beautifully you can see. Yes sir, here is liver, here is stomach, this is our heart, and you can observe gas under the diaphragm on the both side. कभी भी ऐसा आया समझ जाना पेट में किसी विसरा का रप्चर हो गया, अंदर की गैस निकल के राइट और लेफ्ट में जमा हो गई. यस, लेफ्ट साइड गैस is normal, but if gas is on the right side means definitely there is the our hollow viscous perforation for which you will do emergency laparotomy. Agree beta? So this is your integration. Yes 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 Priyanki Patel, you are right beta. Now look here, there is another question. NEET PG 2021, a patient following a road traffic accident presented with the subcutaneous emphysema. On auscultation, there was the no air entry on the right side. Vitals were unstable. Sorry. So what you will do? Definitely this is the case of the tension pneumothorax, for which we do the fifth intercostal space. Do you remember fifth intercostal? Remember this one, tension pneumothorax. We had seen the intercostal space anatomy. We had seen there is the our thoracocentesis. Remember this thoracocentesis is done in the mid-axillary line at the 8th intercostal space. 8th intercostal space. Getting the point? Yes, just along the upper border of the rib. This is done for the pleural effusion, but tension pneumothorax is for the air. Yes, this is for the pleural effusion, but it is for the air in our mediastinum part, and it is done at the 5th intercostal space and 2nd intercostal space in the children. Yes, it is very most important. Again, I am mentioning the NEET PG 2023. So get ready for this topic. Okay, getting the point? Fine. So this is the question you have to remember. Now can you see again radiology NEET 2022? Yes, 2022, and here was the question 2021. This topic had been asked in your 2021, 2022. So now get ready for this topic in the 2023. 80% chances that this tension pneumothorax intercostal space, the knowledge of the thoracic cage, is going to ask in next NEET PG exam. Yes, yes. Thank you, AB Bharat. You are conceptual and we are brainstorming. Thank you, beta. Yes, definitely you all will enjoy this all the session. Okay. Yes, sweetie, you're right. For the more knowledge, you can go for the surgery. Now, look here. A patient is brought to the casualty after the road traffic accident. बिल्कुल road traffic accident से question आना ही है. On examination, the patient is conscious. BP is 90/60 down. Respiratory rate is 40. Okay, pulse rate is 120 beats per minute. X-ray is shown below. What is the best next step? So you can see here. Can you observe? There is the tracheal shadow shifting. Yes, there is the word tension pneumothorax, lung marking on the left side. It is not proper. Tracheal deviation. Yes, you can clear cut. You can observe. Sir, there is the tracheal deviation. Also, there is the word mediastinal shifting. Can you see? Here on the left side, not proper lung shadow are there. So you will do, this is again our tension pneumothorax chest tube insertion. Definitely this topic is going to ask. Now look here, the question. A male patient had feeble femoral pulse with upper limb low blood pressure of 186/90 mmHg. Chest x-ray showed enlarged intercostal artery. What is the likely diagnosis? So you can see definitely femoral pulse is low, but blood pressure is approximately normal. So there is the our, yes, coarctation of the aorta. You all are aware if there is our aorta. Yes, sir. There is the BSC. Yes, that is brachiocephalic artery, subclavian artery, common carotid artery. But if there is the narrowing here, you all know, if there is a narrowing, then blood is passing very nicely on this side, on head side, but blood is not passing here, not passing here. So here is the low blood pressure, but here is the high blood pressure. Also you can say normal blood pressure. Okay, and there are the different branches from this descending thoracic aorta. These are, yes, posterior intercostal artery, which are anastomosing with the anterior intercostal artery. So if there is the narrowing, no blood in this aorta, so no blood in the posterior intercostal artery, so blood will go more from here. It is located just below the rib, so it will cause rib notching. Okay, in detail class we teach the detail, but it is sufficient. So remember, the rib notching is seen in case of the coarctation of the aorta. And next is our 56-year-old female patient presented with the progressive dysphagia for the solid. Yes, it is saying for the solid, loss of weight and loss of appetite, barium swallow. Can you see there is the shouldering effect? Yes, sir. And this is the stomach. So this is not the achalasia cardia, this is our carcinoma of the esophagus. So remember this point, carcinoma of the esophagus, yes, shows irregular narrowing, mucosal destruction and shouldered margin. This is very important. In achalasia cardia, yes, you will see rat tail sign, bird beak sign and the cucumber sign. RBC, such kind of the mnemonic you will use. Okay, and diffuse esophageal spasm, there is a cork screw appearance of the esophagus. So you can see the zigzag appearance. So this is our diffuse esophageal spasm. Agree, beta? Fine. Okay. Yes. Now look here, our more question. 30-year-old woman presented with the hypertension, chest pain and cramping of the legs. Agree, sir? Chest radiograph was taken which revealed a condition as shown in the image. What is likely cause of the hypertension in the patient? And you can see easily, sir, here is our figure of 3 appearance, and this figure of 3 is seen in case of the coarctation of the aorta. Agree, everybody? So you will see more things. This all will be useful for the NEET PG 2023. Now look here. Yes, this is the one question I told you. Whenever there is the involvement of the dermatome, yes sir, dermatome, in that situation your answer is herpes infection, skin integration. So MHD sir is here. We are integrating the anatomy, skin as well as our microbiology. Getting the point? So this is typical presentation. Yes, nipple T4. So this is our T3 dermatome. So there is the painful vesicular eruption. Can you see vesicular eruption? Sir, there is the vesicular eruption. Yes, and remember it is a very painful. Agree everybody? So don't forget it. Yes, thank you, melanophile. Sorry if I'm doing pronunciation wrong. Thank you beta, you all are giving the so beautiful appreciation. So nice. 152 students are still there, so we will continue this session. And yes, now we are starting our abdomen 360-degree integration. Okay, so we are going to start our abdomen. We will complete all the things. Only now the abdomen and the pelvis part is remaining, and then we had completed. But this abdomen part is very high yielding in integration with the surgery. Direct question from the anatomy they are not asked, but it is very very important from the point of the. Just give me a few seconds for the vocal rest. Okay, thank you MD, thank you. So just hear one song for all of you so that you can get refreshed and we can continue. Okay, try to understand. कोशिशें कोशिशें करते रहना ही जिंदगी है. इस जिंदगी में आप देखेंगे खूब ज्यादा रश है, खूब ज्यादा दौड़ भाग है, और हम बस चले जा रहे हैं चले जा रहे हैं चले जा रहे हैं, समझ में नहीं आता कि हो क्या रहा है. याद रखिए इन लाइनों को. ओ सेवंथ स्ट्रिंग, थैंक यू बेटा. फील वेरी प्राउड टू हैव स्टडीड फ्रॉम यू पीटी जैनम. यस, I very very I'm very emotional for my Pandit Janam Medical College. Yes, seventh string, can you tell me your name बेटा? अगर आप अपना नाम बताएंगे तो मोस्ट प्रोबेबली मैं बैच भी बता दूं. मुझे मोस्टली अब धीरे धीरे थोड़ा भूलना चालू करें, लेकिन फिर मैं याद करता हूं. मैं अपनी मातृ संस्था पंडित जैनम मेडिकल कॉलेज रायपुर छत्तीसगढ़ को याद करता हूं. मैं अपने एचओडी सर डॉक्टर सी के शुक्ला सर को याद करता हूं, अपने डिपार्टमेंट को याद करता हूं, जिनके प्यार और आशीर्वाद के कारण मेरे अंदर टीचर बनने की एक ललक बनी रही और आप सभी बच्चों का प्यार मिलता रहा, और आज मैं आप लोगों के साथ मिल रहा हूं, पढ़ रहा हूं. थैंक यू. यस, थैंक यू संजय. लव फ्रॉम द दिंगचिका एनाटॉमी सेवंथ स्ट्रिंग. ओ दीक्षांत, यस आई नो. और मैं आपको बता देना चाहता हूं कि दीक्षांत जो है बहुत बढ़िया गिटार बजाते हैं. इनकी एक छोटी सी टीम है. दीक्षांत, अगर मैं सही बोल रहा हूं तो बताओ भाई. दीक्षांत के पास एक बहुत ही अच्छी टीम है और ये छोटे छोटे गाने बनाते हैं और ये गिटार बहुत अच्छा बजाते हैं. दीक्षांत, एंड आई थिंक यू आर सेम फ्रॉम द बैच ऑफ द I'm just getting forget the many names. Okay, so I very very happy that you are here, Dikshant. Yes, love from the Kerala is very beautiful state, and Kochi was one of the my first class. Yes, Daredevil, I think Daredevil you came for the last time also. Word of that gleamed over. Yes, thank you. Okay, Sanjay is from the Sims is very lovely place. और मुझे सिम्स के गोलगप्पे भी याद हैं. वहां जो हमारी माँ अरपा की नदी होती थी सिम्स के ऊपर छत में, बहुत पहले जो रैकिंग होती थी तो वहां पर पूछते थे ये कौन सी नदी है, और बच्चे बोलते थे सर ये अरपा नदी है. एक झापड़ पड़ता था, माँ अरपा बोल बे माँ अरपा. तो ऐसी प्यारी प्यारी यादें जुड़ी हुई सिम्स बिलासपुर के साथ, और वहां के गोलगप्पे, वहां के गुपचुप मुझे बहुत याद आते हैं, वहां के बच्चे बहुत याद आते हैं. सिम्स बहुत ही बढ़िया जगह. जगदलपुर की मुझे बहुत ज्यादा याद आती है. Yes, thank you sweetie, thank you. 2012 Sims. Okay Sanjay, very nice, वेरी नाइस, वेरी नाइस. संजय, क्या आप वही हो जो एकलव्य लाइब्रेरी में आया करते थे? मुझको ऐसा याद आ रहा है. फाइन, सो थैंक यू. ओके, चलो कुछ बढ़िया सी लाइनें हम गाते हैं और फिर उसके बाद हम आगे कंटिन्यू करते हैं. तो ये रास्ता, ये जिंदगी क्या है? बस एक रास्ता है और इसमें हम चल रहे हैं. याद रखिए, चलना इंपॉर्टेंट है, मंजिल मिले या ना मिले ये इंपॉर्टेंट नहीं है. जो हम सफर करते हैं वो खूबसूरत होता है. मंजिल जब मिल जाती है तब तो फिर बस आराम और उस मंजिल, उस सफर की यादें रह जाती है. सो व्हाट आई वांट टू टेल यू. यस संजय, माँ अर्पा. ओके, यस थैंक यू। देखो बेटा, एनाटॉमी एक ऐसा सब्जेक्ट है जो नर्सिंग, फिजियोथेरेपी, हमारे डेंटल के बच्चों को, एमबीबीएस के बच्चों को, कोई भी मेडिकल फील्ड से रिलेटेड हो, एनाटॉमी की तो जरूरत पड़ेगी ही पड़ेगी। ओके, तो एक गाना आप सभी लोगों के लिए, सुंदर से सफर के लिए, एक रास्ता है जिंदगी जो थम गए तो कुछ नहीं, ये कदम किसी मुकाम पर जो जम गए तो कुछ नहीं। याद रखिए दोस्तों कि हम जिस सफर पर चल रहे हैं ये बस चलती रहती है। ये जिंदगी जो है ये एक रास्ता है, एक रास्ता है जिंदगी जो थम गए तो कुछ नहीं। जिस दिन हम कोशिशें करना बंद कर देते हैं जिंदगी की घड़ी वहीं पर रुक जाती है। ये कदम किसी मुकाम पर जो थम गए, अगर चलते चलते हुए हम कहीं पर रुक गए तो मतलब अब जिंदगी खत्म हो गई। ईसीजी में भी आप जानते हैं कि ईसीजी, ये बहुत फेमस लाइन है, ईसीजी में अगर लाइन टेढ़ी मेढ़ी है मतलब आप जिंदा हैं। जिस दिन ईसीजी की लाइन सीधी हुई कहानी खत्म। सो होप यू ऑल आर enjoying this all the points. Yes Sanjay, miss you beta, miss you. Okay, so now we are going to continue this abdomen 360 degree. Yes melanophile, thank you. So hope you all are enjoying the session. Now come to the abdomen 360 degree integration. Yes, look here, a patient with history of the pain in both legs while taking long walk, he has developed toe gangrene and he admits to have erectile dysfunction. अरे भाई ये तो फिर से वही क्वेश्चन आ गया, arterial supply, which of the following arteries involved here? Definitely we had already seen the aortoiliac junction, again same arterial disease. So arterial disease and the venous disease, same question will be there, aortoiliac junction. Hope you all are getting the point. Yes Rakesh, you are right beta. Now what I want to tell you, for the NEET PG exam you have to learn the peritoneum ligament. In our bullet train anatomy, again I want to tell you, if you are having the time, don't watch the our video 7.30 hours, our session bullet train anatomy at our Cerebellum Academy. It is available. Okay, 7.5 घंटे में पूरी एनाटॉमी अदर सब्जेक्ट के साथ इंटीग्रेट करते हुए हमने खत्म कर दी थी. Okay, so you can watch there. Yes, there we had seen the transverse section of the abdomen. Sir, this is our vertebra. You can see this is our anterior abdominal wall and here is the posterior abdominal wall. You can see the stomach here. Yes, stomach के आगे ventral mesogastrium जिसमें आपका लीवर डेवलप होता है. Here you can see the ventral part of the ventral mesogastrium and this is the dorsal part of the ventral mesogastrium. We had discussed in the our bullet train anatomy in detail. You can go and at the back side of the stomach there is the our spleen. Yes sir, this is the spleen. So this portion is our dorsal mesogastrium. So this is the ventral part of the dorsal mesogastrium and it is the dorsal part of the dorsal mesogastrium. मैंने बड़े मजेदार तरीके से आपको बताया था कि अगर कोई पूछता है कि तुम्हारे पास दिमाग विमाग है कि नहीं, यस राइट नाउ द क्वेश्चंस आर आस्क्ड दिमाग विमाग, तो मैंने आपको बताया था यस हमारे पास दिमाग भी है, हमारे पास विमाग भी है. दिमाग dorsal mesogastrium which is dorsally present, ventral mesogastrium which is ventrally present. So again we are dividing this dorsal and ventral mesogastrium into the dorsal part, ventral part, dorsal part, ventral part. Getting the point? Now look here, this ventral part of the ventral mesogastrium, it is giving rise to the ligamentum falciform. So arrow was over this part, so your answer is yes, falciform ligament C. Also this dorsal mesogastrium, sir, it is between the stomach and the liver. Yes, you can say hepatogastric ligament. Also you can say the laser omentum. Yes, you can see here the ventral mesogastrium, it is between the spleen and stomach. That's why it is our gastrosplenic ligament. And here is our ligament behind related to the kidney. So remember this is our yes lino-renal ligament. In the FMG recent question and it is the old NEET PG question, remember the abdominal aorta is giving the branch which is supplying the spleen. Splenic artery, sir, splenic artery is running within our dorsal part of the dorsal mesogastrium. Yes, so this question had been asked in your FMG 2023 January session. Remember, this is very important question, and it is giving the artery. Which artery? Short gastric artery. So short gastric artery is running within our gastrosplenic ligament. So here is our short gastric artery, while the lienorenal ligament, it is having the our splenic artery. Agree everybody? So these are our few questions in this question pattern 2020-22. Answer was the falciform ligament. What I want to tell you, don't miss for the NEET PG the peritoneal ligament. Agree? So in the NEET PG, let's see, NEET PG 23, we are guessing tabardod PYQ session we are doing. Okay, so peritoneal ligament, NEET PG 2023 question. Remember, this is important topic. Now see here, another NEET PG 2021 question had been asked. A 34-year-old man presented with the fever, massive splenomegaly. On palpation, spleen was 15 centimeter and direct obliquely. Vein measured from the right iliac fossa. Which of the following structure prevent the vertical downward descent? So here in between the colon and the diaphragm, there is the phrenicocholic ligament which makes one slope. So spleen grows towards the our umbilicus and towards the right iliac fossa. Answer is phrenicocholic ligament. Go for our bullet train anatomy. What I want to tell you, in the NEET PG 2021 the question had been asked, and our NEET PG 2022 this question had been asked. Yes, the peritoneal ligament, again it had been asked in the NEET PG 2021, 2022. So definitely 2023 one question is sure from the peritoneal ligament, peritoneum, peritonitis. Agree beta? Yes, thank you, thank you, you all are right. C is answer. Dr. Anjali, Jasmeet is here, Janvi is here, Dr. Rao, Vaishnavi, Santhani, Ankur. Yes, everybody. Yes, ABCD. Hello, dear. How are you? Thank you for your wishes. Now come to our next question. Better NEET PG 2020. Yes, you can see the tumor of the uncinate process of the pancreas affects which of the following vessel? So remember this one. Suppose this is our pancreas. Yes, sir. Suppose this is pancreas. So I told you at that time, sir, there is our, you can remember, from the spleen, splenic vein is coming. Yes, sir. This is splenic vein. And here is our superior mesenteric vein, which is passing. Yes. Just in front of our this particular uncinate process, and then passing backside and then making the portal vein. Yes, it is making the portal vein, and then it is emerging out and passing in this way. So what I want to tell you, you must remember splenic vein. Yes, sir. You must remember the superior mesenteric vein. Both are uniting and making the portal vein. I told you the equation. Yes, portal vein is equal to superior mesenteric vein plus splenic vein. Yes, remember, no excuse. Portal vein is the most important vein of the abdomen. Entire our hind gut, mid gut, they are draining into the portal vein. Remember where it is formed? Behind neck of what? Pancreas. At which level? Remember L2. MCQ, MCQ, MCQ. Fine. So these all are very important point. Also adding few additional knowledge. Remember there is our duodenum. Yes, sir. Duodenum is in this way. Yes, this is our first part of the duodenum, second part of the duodenum, third part of the duodenum. Very easy you have to remember. This D1 is located at L1, D2 is located at the L2, and D3 is located at which vertebral level? L3. अरे कितना आसान है, रटना ही नहीं है, बहुत आसान है, कोई भी दिमाग लगाने की जरूरत नहीं है. Anatomy is totally conceptual subject. Yes, first part of the duodenum, D1 at the L1, D2 at the L2, D3 at the L3. So easy. So where this portal vein is formed? MCQ. This portal vein is formed behind the neck of the pancreas at the vertebral level of the L2. No excuse. Yes, when I taught you the our, do you remember? Epiploic foramen. Here was the epiploic foramen. Do you remember the foramen of Winslow? Please recall the foramen of Winslow. Its inferior boundary was formed by the D1. So this is the NEET PG 2016 question. What is the vertebral level? What is the vertebral level of the foramen of Winslow? सीधी सी बात है. एक चीज बताओ, which vertebra is located above the L1? Sir, T12. So this question had been asked. Just above the our D1 there is a foramen of Winslow. Yes, D1 is located at L1. So definitely, damn sure, foramen of Winslow is located at which vertebral level? Sir, T12. This is the common sense. कॉमन सेंस वो चीज होती है जो कॉमन नहीं होती. सो नो नीड टू मग अप द एनाटॉमी. इफ योर एनाटॉमी इज स्ट्रांग यू विल गेट ऑल द सब्जेक्ट स्ट्रांग. नाउ लर्न दैट portal hypertension from the surgery, from the medicine, different subject. You can see the supramesenteric vein is passing in front of the our uncinate process. Getting the point? Yes sir, uncinate process. So you can see the tumor of the uncinate process, it will compress what sir? Superior mesenteric vessels, artery as well as vein, both are running together. Hope you all are getting the point. Oh, I am so blessed, beta. Thank you so much. Arya sir is my godfather, my school teacher. Due to him, I got selection in my NEET UG exam. Thank you. When I went for the Gujarat, तो जब मैं गुजरात गया था बीजेएमसी मेडिकल कॉलेज में 300 बच्चों की क्लास चल रही थी, मैं वहां पर पढ़ाया था. एक बच्चा गुजरात से दौड़ते हुए आया और उसने कहा क्या आप आर्या सर के स्टूडेंट हैं? मैं हक्का बक्का बहुत चक्का रह गया. सेम थिंग बेटा, ABCD, कैन यू टेल मी योर गुड नेम बेटा? आई एम वेरी हैप्पी, वेरी हैप्पी. यस बेटा, यस 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 यस. मैं 2017 में आर्य सर के यहाँ केमिस्ट्री की क्लास में आया था. बहुत अच्छी यादें हैं हमारी आर्य सर के साथ. ओके, so I'm really very emotional for the Arya sir, for all the students who are connected with the Arya sir. Thank you. Yes, please connect me. ABCD, this is my personal number 91317839495. Yes, for Arya sir, please connect me beta. I am really really happy that a student of the Arya sir is here. Okay, okay, so thank you very much. Very happy to meet you, to talk you. Okay, तो बेटा बात करना. यस यस, लॉर्ड नॉक्सिक्रोलिन. ओके, yes 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 yes. Thank you beta. Yes, we are continuing. Thank you Jason, thank you for recalling me. Okay, चलो 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 भाई, पढ़ाई करनी है, एग्जाम है पास में. ligation of the common hepatic artery will impair the blood supply in. Now can you tell me what is your answer? Yes yes yes, tell me. Right gastric and the right gastroepiploic artery, right gastric and left gastric artery, right gastroepiploic and the short gastric vessels, and right gastric and short gastric vessels. Tell me what is your answer? Yes 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 yes. See here, tell me the answer. Yes yes, Jason, tell me the answer beta. Yes, tell me what is the answer. Yes, I am drawing this esophagus, and here is the your stomach, and here is your duodenum, and these all are the parts. Yes, tell me the answer. Here is a celiac trunk. Celiac trunk is giving the branch, that is the left gastric artery. Yes, it is giving the branch which is running behind the stomach. Yes sir, this is our splenic artery, and it is giving the branch towards the liver. This is our common hepatic artery. Now remember, this common hepatic artery is dividing into two. That is our proper hepatic artery, and you can see this is our gastroduodenal artery. Now see, this artery is running here, and it is further dividing into the superior pancreaticoduodenal artery, and here is our, yes, our right side gastroepiploic artery. You can observe this is our superior pancreaticoduodenal artery. Getting the point? Okay, so these are our different points which you can remember. Also you can see here the another artery is coming from here, left gastroepiploic artery. Getting the point beta? Okay, fine. No lord proxygen, Jason is right beta. Jason is right. Don't. Okay, so enjoy everything. Okay, fine. If you're getting it is beneficial, you can continue, and if you're not getting the beneficial at the beginning of the session, I told you, please focus on your own study. But what I want to tell you from this session and the bullet train anatomy session, 100+ topics sure shot at the day of the exam we will talk. Okay, so this is surgery integration. Now can you tell me which arteries are here? The answer sure short, NEET PG, this knowledge will be useful. Yes, I am telling you, this is your left gastric artery, and this is our splenic artery. Agree everybody? Yes. Now look here, more things are there, but we are stopping here. Now see here, there are our different option. Ligation of the common hepatic artery. It is asking about the common hepatic artery. So you are doing the ligation where? Yes, you are ligating here. This is your common hepatic artery. So your gastroduodenal artery will be hampered and your right gastroepiploic. Also remember one more artery. This is your right gastric artery. Sir, this is the right gastric artery. Means right arteries are involved. Sir, here all the right gastric artery, right gastroepiploic. A is given. You all are very right. Yes, Dr. Reformer, Janvi, Vaishnavi, Sanjay, Sayyad, you all are perfect, beta. Yes, Sanjeet, Jason, you are right, beta. ABCD, you are right. Ankur, everybody, you all are having the preparation in the very good way. Now, can you tell me all of the following structures are derived from the aponeurosis of the external oblique muscle? I told you all the concept, but do you remember external oblique? I told you the mnemonic. Yes, lip. L for external oblique derivative. L for, remember this one, sir, lacunar ligament. I for, yes, inguinal ligament. P for, yes, pectineal ligament. So definitely I is here. Yes, our lacunar ligament is here and pectineal here. But this L is linea semillunaris. We all know linea semillunaris is the lateral border of the rectus. Our, yes, you all know lateral border of the rectus abdominis. So answer in this question is D, linea semilunaris. Okay, now come to the next. Integrating with the our surgery and medicine, main one syndrome. Again, the main syndrome, definitely the gastrinoma triangle. Yes, the Pizarro triangle. You all know there is the our junction of the gallbladder, cystic duct and common hepatic duct. There is a second and third part of the our duodenum and jejunum, and there is the junction between the neck and the body. So when you are uniting this all the point, so there is the formation of the Bermuda triangle. Okay, no, not the Bermuda triangle, it is the Pizarro's triangle, it is the gastrinoma triangle. It is the most common site of the gastrinoma where this duodenum is falling. So remember, most common site is the our duodenum. Why I told you this Pizarro triangle, you read in your anatomy, and this is the common site for the gastrinoma. You all know in case of the gastrinoma there is the increased G cells. G cells are responsible for the secretion of the gastrin hormone physiology integration, and due to this gastrin hormone, there is the increased HCl. There is a recurrent attack of the ulcer which is known as the Zollinger-Ellison syndrome, and the drug of the choice for the Zollinger-Ellison syndrome is our pantoprazole. So these are our different integration with the anat, surgery, physio, yes, pharma, as well as medicine, and any topic which is integrating with the different subject. So remember, that is your very high yielding topic. Get ready for this topic. Any kind of the question may be there. Okay, yes, see here beta, boundaries are there. You will see there is the our junction of the gallbladder, cystic duct and common hepatic duct. Next is our junction between the second part and the third part of the duodenum. So this junction, this particular part, agree, this particular part, and third is the, here is the neck of the pancreas, and this is the body of the pancreas. So this junction, so you have to unite these 3 points. So this is our gastrinoma triangle, this is our Pizarro triangle on the name of the surgeon. Agree? Yes, puppy is the answer. You have to give the puppy to that patient. Okay, pantoprazole, PPI, proton pump inhibitor. Okay, fine. So puppy is the answer. Now come to the our next integration, surgery NEET 2020-22 integration. A 6-year-old boy came with the history of the recurrent UTI. Definitely one question from the UTI, and here is the image. Can you observe there is our kidney portion? Yes sir, here is our kidney, and this is the ureter. You can see the urinary bladder, and here is the urethra. So you can see there is the our dilated ureter. That's why this is our vesico-uretary reflux. So integrate this anatomical points. If you are having the proper knowledge of the anatomy, you can understand the radiology and vesico-uretary reflux. You know, in your pathology, in your pediatrics, you learn this all the things. So this is the beautiful integration of the anat, surgery, radio, patho, yes, pedia, vesico-uretary reflux. It is commonly seen in children, as well as microbiology, because it is UTI. Yes, most common cause of the UTI, you all know sir, E. coli. Okay, now come to the our next question. Yes, these all are the things which you can learn from the topic. These are the different grading you have to learn. And can you see again, sure short one question from the kidney, our urinary system. You can see delayed intravenous urogram is given. So you can see this is the situation where you can learn, you can see this different point. But here nothing is visible. Why? Because there is a pelvic-ureteric junction obstruction. So these are the points which you have to remember. Definitely damn sure from the urogram. Yes, urine obstruction. Yes, UTI. I'm not making the very good writing. It will take time. So kindly sorry to me, pardon to me. Okay, fine. Okay, yes. So now come to this question. Yes, putti kidney is also important. Fine. So these are our different points. Our Staghorn calculus stone is important. I told you. See here, NEET PG 2021 in a patient with the abdominal pain and sterile pyuria. What is the finding shown in the image? So there was the our appearance. Yes, this is our putti kidney. Why you will say the putti kidney? Homogeneous and ground glass like calcification. That's why. So remember the different kind of the stone, urogram, kidney appearance. These all are important. Now see, there is a question. Yes, what I want to tell you, multi-drug resistance TB shows resistance to which of the following drug? Answer was the isoniazid and the rifampicin. Getting the point? Why I am telling you integrate the sure short question from the TB. ऐसा कोई एग्जाम बोल दो जिसमें टीबी से क्वेश्चन ना आए, हो ही नहीं सकता, वो एग्जाम हो ही नहीं सकता, टीबी से क्वेश्चन जरूर आएगा. आइदर फ्रॉम द योर यस फार्मा, मेडिसिन, community medicine, or your medicine or surgery part. Yes, orthopedics, there is a POTS spine, tuberculosis, leprosy, definitely question will be asked. Without HIV, any exam cannot be complete. Yes, COVID you must study. Hepatitis, especially the jaundice due to the alcohol. Yes, alcoholism, there is a liver failure and no excuse with the meningitis and bleeding in the cranial cavity. The sure short question topics. Yes, go for the NEET PG 2023. Yes, 2023 integration. Now see here, these all are the question pattern. NEET PG 2022, I told you the hepatitis. Yes, sure short liver hepatitis jaundice, this question is going to ask. See here, patient presents to you with the fever, jaundice and malaise. What is the most likely diagnosis based on the serology report? So can you see here, there is our, yes, anti-HBs is negative. So this is one very clue point which is indicating the our acute hepatitis. Different findings are there, you can go, but yes, remember anti-HBs is negative. Agree? Fine. So now come to our next question. Again, radiology integration. A 40-year-old man who is known case of the hypertension presented with the multiple episodes of the hematuria and loin pain. Yes, loin pain means kidney involvement. Yes, his elder brother passed away due to the stroke at the age of the 40. Now the ultrasound abdomen is shown below. What is the probable diagnosis? Getting the point? Yes, yes. So see here, this is our kidney part and you can see the multiple cyst polycystic kidney disease. Again, one question sure from the kidney urinary part. This is our autosomal dominant polycystic kidney disease. You all know there are the polycystic kidney disease type 1 and type 2. Yes, type 1 is due to 16 chromosome and type 2 due to 4 number chromosome. You can easily remember 4 multiplied by 4, 4 4 ja 16 is your answer. So learn this all the topic. Now look here, there is a one more question. A child had a history of the stab injury on the anterior abdominal wall and the image is shown below. The child is hemodynamically stable. Which will be the next course of the treatment? So you can see the peritoneum is coming out. Yes sir, this is our peritoneum. Okay, so you will perform the emergency laparotomy. Evisceration of the omentum. Omentum is the nothing, our peritoneal fold attached to the stomach. So emergency laparotomy is performed to explore and repair abdominal injury in hemodynamically instability if the patient is having the peritonitis, evisceration and the gunshot wound also. So these are our different points. Now look here, our next question. A patient after a road traffic accident presented with pain abdomen. Hope you are getting the point. Yes, Melanophile, you are right. Anjali, you are also right. Yes, Anthony, Soumya, Dr. Rao, you all are perfect. Okay, so a patient after road traffic accident presented with the pain abdomen, the resident examines the child and found that vitals were stable and tenderness was present in the left lumbar region, which is the best investigation. So remember, this is the case of the blunt renal trauma. How you will see, sir, lumbar region is your friend, and in case of the blunt renal trauma you will go for the CCT. Okay, and also there is the question, but sorry, I am not having the complete question pattern for this. Identify the most common site of the intra-abdominal abscess surgery NEET 2022. So there was the question pattern, and answer was the subhepatic space. It is nothing, it is our peritoneum topic. Sorry, I am not having the exact question pattern, but I am telling you the peritoneum, peritoneal cavity, peritoneal ligament, it is important. Okay, now come to the our next question. Yes, see here, rectum anal canal, anatomical question they are not asked, but fissure in anal, fistula in anal, they are important. So just to see, a man came with complaint of the recurrent discharge and pain due to the lesion around the anus for the 3 years. Okay, what is the diagnosis? Yes, see here, splenic trauma. In case of the splenic trauma, pain will be felt on the our left hypochondrium, but it is saying about the lumbar region, lumbar position. Simple knowledge you have to know about the 9 quadrants of the abdomen, more in favor of our, yes, renal. Simple logic. Okay, so this is your diagnosis. You can see this is our anus, and abnormal opening is, you can see, this is the fistula in ano. And don't forget to go with the our Goodsall's rule, and this is the our different points. Okay, now see here, a patient presents with the hernia medial to the inferior epigastric artery. What is the most likely diagnosis and appropriate management? So this is the direct hernia. Yes, again I want to tell you, breast, hernia, thyroid. One question sure shot. I told you that anterior superior spine, pubic tubercle, pubic crest, pubic symphysis, and here is our ligament. Which ligament, sir? This is our inguinal ligament, and this is our thigh part. You all know the superficial inguinal ring is triangular, just above the our pubic symphysis. Yes, better to say pubic ridge. Okay, yes, pubic crest, and here is the oval opening. So this is our inguinal canal. Now try to understand, here is our inferior epigastric artery and muscle. Which muscle, sir? Rectus abdominis is located here. So you all can easily guess this is our Hasselbeck triangle. Agree? So if any hernia is occurring, yes sir, if any hernia is occurring directly through the our superficial inguinal ring, this is direct inguinal hernia. But if any abnormal protrusion of the viscera, yes sir, it is occurring through the deep inguinal ring, then inguinal canal, then superficial inguinal ring, then it is our inner direct inguinal hernia. Can you see this direct inguinal hernia is coming medial to the inferior epigastric artery? Simple. Direct inguinal hernia is medial to the inferior epigastric artery. Getting the point? Okay. So now we are going to look our next question. See here, what I want to tell you, no excuse with the stone. Stones are important. Either the gallbladder stone, also you have to observe for the renal stone. Agree everybody? Question, a 54-year-old female patient presents with the abdominal pain and bilious vomiting. Okay, now she had a history of the abdominal hysterectomy. Uterus you are cutting 2 years back. Abdominal auscultation revealed hyperechoic bowel sound. Investigation show air within the biliary tree. What is the most likely cause? Remember the gallbladder magic of three parts, 3 sides of the referred pain. 30 ml to 50 ml is your, yes, our capacity and the 3 boundaries of the Callot's triangle. So that magic of the 3 for the anatomy. And remember, this gallbladder is a site for the stone formation. If it is reaching into our intestine, that is a gallstone ileus. Now see here again, NEET PG 2021, the question had been asked, Patient underwent cholecystectomy for the gallstone 2 years ago. She now presents with the symptoms of obstructive jaundice. Investigation reveals a stone in the common bile duct. Yes, it is the primary stone. Look in your surgery, but what I want to tell you again, stone is important. Definitely one question either from the renal stone or for the gallbladder stone. Yes. Now look here. Another question, alcoholic patient with the severe abdominal pain, pancreatitis. So remember one question from the pancreas. Yes, you know alcoholism is very common, and due to the alcoholism there is the our acute pancreatitis. Also in female, stone is very common, and this stone is causing the acute pancreatitis. Okay, CT scan revealed echoic lesion with fluid collected near the body of the pancreas. So for the pancreas, amylase is important, lipase is important, but more specific, better is the lipase. Okay, now look here, the NEET PG question. Yes, beta, we are doing the integration. What I want to tell you, don't fear from the anatomy. You have to integrate the anatomy with other subjects, then automatically you will make strength for the anatomy, as well as other subjects will be also easier. Thank you for your beautiful lines. Hope you all are liking the session, beta. If you're liking the session, just give me the positive comments. It will enhance our energy for you all. Okay, yes. Next question. 25-year-old patient presents with the abdominal pain, fever for 3 days, duration. Chest X-ray in the erect position is given below. Yes, I think we had seen this question. Yes, sir. The gas under the diaphragm. So here you can see the gas, here you can see the gas. So definitely this is the hollow viscous perforation. Now come to the our NEET PG 2022. Why I am telling you insulin and diabetes mellitus, pancreas, no excuse. Diabetes, don't leave this diabetes. Okay, pancreas is important. Yes, in histology, islet of the Langerhans has been asked, and diabetes is not no excuse. Okay, diabetes mellitus for the past 5 years presents with the vomiting and abdominal pain, and she is non-compliant with the medication and appears dehydrated. Yes, investigations revealed a blood sugar value of the 500 milligram per deciliter and the presence of the ketone bodies. So this is your case of the, yes, see, you will see in the medicine. Okay, definitely you have to give the intravenous fluid and the regular insulin. Okay, so thank you Vaibhav, thank you beta, thank you. Definitely Lord, Lord, definitely INICET उसकी भी हम धज्जियां उड़ाएंगे. I did the INICET pattern and 97.1% for the INICET strike rate. So at this Cerebellum platform also we will do the same INICET. Yes, I was having the 97.1% strike rate. So don't worry, one by one every session will break, but right now we are focusing for the NEET PG. Okay, yes, this is our situation of the diabetic ketoacidosis. Perfect, Mander, Mander beta. Yes, thank you. Okay, yes, go for the euro detail part. Okay, now look here, a patient with a history of the chronic liver disease presents with the abdominal distension, jaundice, and pruritus. Ascitic fluid analysis revealed neutrophil count more than 650 per cubic mm. What is your most likely diagnosis? Yes, it is your job. You have to look in the medicine and surgery. What I want to tell you, this jaundice, sir, it is saying about the liver and liver failure, jaundice, hepatitis. Damn sure one question is going to ask. Yes, it is our case of the SBP. Okay, yes, I already told you, you must know the peritoneum, peritoneal ligament, peritonitis. Damn sure the NEET PG 2023 one topic is going to ask. Agree? Now look here, there is a one topic again. Now we are going to correlate with the ops gynae. See here, there is the our pelvis 360-degree integration. So we are going to look for this all the pelvis 360-degree integration. Okay, so we are continuing this session. Again, look here the question. A primary gravida female after delivery continued bleeding from the uterus. Okay, sir. Patient was taken to the OT and planned for the uterine devascularization. Agree, sir. Mark the correct order of the devascularization. Do you remember I told you the, I am again opening the bullet train anatomy, our notes. Yes. So at the pelvis part, I told you all the entire arterial system. Yes, this perineum area, our pelvic diaphragm, all the question. Yes, our urethral injury, sure question is going to ask from this topic. Okay, and we had seen the arterial supply, the branches of the aorta in a very funny way we did in our bullet train anatomy with the Bahubali scene, just like our Bahubali. And also the branches of the internal iliac artery, anterior division, posterior division. Anterior division was supplying our pelvic cavity organ. Yes, superior vesical artery, inferior vesical artery, uterine artery, vaginal artery. Superior rectal artery was the branch from the inferior mesenteric artery, but the middle rectal is the branch from our anterior division. But posterior division, I told you, I love Salman, Sonakshi. Few students says, yes, Sunny. So I love Sunny, whatever you want to do. I love Salman, Sonakshi, Sunny, whatever. Yes, SRK you can do. I for iliolumbar is the posterior division. Okay, L for lateral sacral, and S for superior gluteal. So we had seen this all. So this is one our integration. Now look here. Can you tell me the uterine artery? Definitely, if there is the bleeding, you have to block the uterine artery, sir. But uterine artery, uterine artery, uterine artery, uterine, all are having the uterine artery. So all are correct. Now look, if bleeding is there, then it is the branch of the internal iliac artery. Yes, it is the branch of the internal iliac artery, fine. But why you will like it the obturator artery? Yes, this is not the answer. Pudendal artery, yes. Vaginal artery, okay, fine, vaginal artery is correct. But why you are like getting this one? Okay, so mark this one. Yes, you can see here there is the external iliac artery. Why you are blocking the blood supply of the lower limb femoral artery? Yes, can you see ovarian artery, internal iliac artery? Yes, ovarian artery, it is a branch of the abdominal aorta. It supplies the uterine tube from the lateral side and anastomosis with the uterine artery. So among this all the options, this is the best answer. Remaining all not. Okay, yes, Sayanthani, you are right, beta. Yes, yes, getting the point. So now try to understand. There is our next question. You can see surgery NEET 2020-22. You can observe this question. Young male patient with a history of the motor vehicle accident is unable to pass urine. Again, this is the question from the our urogram, urinary part. Okay, blood is seen at the meatus. What is the most likely site of the urethral injury? So you can see here our, yes, urethra, yes, penile urethra. Then here is the spillage. Yes, it is our very narrow part, and this is our urinary bladder part. Getting the point? So this is nothing, it is our membranous urethral rupture, the most common site of the urethral rupture. So remember, it is related with the road traffic accident, urinary retention, and blood at the meatus. That's why you will say there is the rupture of the membranous urethra. So look at your surgery in detail. Yes, there is our retrograde urethrogram, membranous urethra leakage. Now look, always I say to the student, don't leave the prostate surgery patho, yes, BPH, as well as you have to remember the prostate carcinoma. Agree, everybody? So you can see a patient presents following a motorcycle road traffic accident. There was no pain on injury. Examination shows blood at the tip of the urethral meatus. Again, what will be your next step in the management? Because there is a blood at the urethral meatus, so you cannot pass the catheter, you cannot do instrumentation through the urethra. So you will go above the pubic symphysis, and then you will make opening. That's why stoma in the cyst. Cyst means urinary bladder. So above the pubic symphysis, you will cut, you will open the bladder. This is suprapubic cystostomy. Agree? Now see here, a patient presents with the carcinoma of the prostate. Again, there is a question from the prostate carcinoma. Our surgery NEET PG 2022. So damn sure NEET PG 2023 one question. So there is the spreading to the vertebra. What is the root of spread to the lumbar vertebra? In anatomy, I teach all the students the Batson venous plexus. Yes, this Batson venous plexus is connecting the veins of the vertebral column to the prostate, rectum, and the breast. That's why in case of the breast carcinoma, prostate carcinoma, or rectal carcinoma, our senior consultant, they come and they ask for the history of the backache. जब भी ब्रेस्ट कार्सिनोमा हो, प्रोस्टेट कार्सिनोमा हो, रेक्टल कार्सिनोमा हो, आपको पीठ दर्द की हिस्ट्री टेकिंग जरूर करनी है. एग्री एवरीबडी? Fine. So hope you all catching the point. Now we are going to look for the next question. Yes, जब भी बहुत ही घिनौना सा केस दिखे तो समझ जाओ ये क्या, फॉर्नियर गैंग्रीन। बिल्कुल इसको भूल नहीं सकते, इतनी बदबू मारती है, आप कभी नहीं भूल सकते। यस, व्हेन वी वर द यूजी स्टूडेंट वी वर हैविंग द टू मच प्रॉब्लम फ्रॉम द आवर ऑप्स गायनी, समझ में नहीं आती थी, बहुत मुश्किल से पढ़ाई करते थे ऑप्स गायनी, बहुत प्रॉब्लम होता था। यस रिमेंबर वी ऑल द बॉयज, यस उसमें बच्चों लड़के जो होते थे वो फेल हो जाते थे ऑप्स गायनी। यस रिमेंबर वी ऑल द बॉयज वी हैव टू टेक दिस रिस्पॉन्सिबिलिटी, वी विल गो फर्दर प्रॉपर डेवलपमेंट ऑफ द मेडिकल साइंस एंड वी विल क्रिएट द एंड्रोलॉजी, और फिर हम देखेंगे कैसे लड़कियां पास होती है इस एग्जाम में। ओके यस, इन आवर कॉलेज वी ऑल द बॉयज वी आर गेटिंग फेल इन द ऑप्सगानी, व्हाई, बिकॉज यस ऑप्सगानी इज आउट ऑफ ब्रेन फ्रॉम द बॉयज। ओके सो इन द सिमिलर वे एंड्रोलॉजी में क्या क्या टॉपिक होंगे, ऑल द मेल जेलाइटल ऑर्गन एंड द most dangerous topic, this foreigner gangrene. Okay so remember following statement is, I am just joking na, don't take seriously. Okay fine, so true regarding the condition given below. What I want to tell you, andrology से question जरूर आएगा, this is the our 20th subject, andrology. Yes, here the foreigner gangrene, scrotum testis disorder, also the prostate disorder, prostate carcinoma, this all are the topic what I want to tell you, the 20th subject our andrology, एक ना एक क्वेश्चन जरूर आना है। फाइन, सो वी आर गोइंग टू ओके ओके लॉर्ड, हर घर की अलग कहानी, हर कॉलेज की अलग कहानी। ओके सो व्हाट आई वांट टू टेल यू, यस this is our mixed flora aerobic and anaerobic infection. Yes sir, this is our suggestive of foreigner gangrene, where you can see the blackening of the scrotum, this all. Okay now 75-year-old man with the prostate carcinoma presents to the prostate specific antigen with the 9 nanogram per ml with a small tumor focus, his Gleason score is 6. What will be your next management? So you will go for the active surveillance, so this is your yes community medicine पीएसएम इंटीग्रेशन ऑल्सो, प्रोस्टेट टॉपिक ही है, नीट पीजी 2021 में आया हुआ है। नाउ लुक हियर, नेक्स्ट आइडेंटिफाई द ग्रॉस स्पेसिमेन ऑब्टेन्ड फ्रॉम आवर cystoprostatectomy, so you can see this is our yes urinary bladder and here you can see the prostate, so there is a large fungating mass in the urinary bladder, this is our situation of the bladder carcinoma, getting the point? So a large fungating growth from the bladder wall involving the entire bladder, you can see two lobes of the prostate are not too much affected। तो बेटा ये prostate topic आपको जरूर करना है, एंड्रोलॉजी पार्ट आपको जरूर करना है। Now we are looking for the last message, yes final message, just like the previous class I integrated with the many things। yes एक पल का जीना, जिंदगी दो पल की, जीने के हैं 4 दिन, so they all are confused, भाई जीना कितने पल का, एक पल का कि 2 पल का? अगले बार कहते हैं जिंदगी 2 पल की, फिर उसके बाद जीने के हैं 4 दिन, सो ऑल आर गेटिंग कंफ्यूजन। यस कौन फिरकी ले रहा है, व्हाट यू टू रिमेंबर, एवरीथिंग इज जस्ट ओनली द मोह माया, सब मोह माया है। याद रखो मेरे दोस्तों, तुम भूत का पश्चाताप मत करो, तुम भविष्य की चिंता मत करो, वर्तमान में जियो। जिस दिन आप एग्जाम देने के लिए जाएंगे तो तुम भूत का पश्चाताप नहीं करना कि मैंने ज्यादा पढ़ा कि मैंने कम पढ़ा, एग्जाम बनेगा कि नहीं बनेगा। भविष्य की चिंता मत करना कि मेरे को पीजी में सीट मिलेगी कि नहीं मिलेगी, ये कॉलेज मिलेगा कि नहीं मिलेगा, ये रैंक मिलेगा कि नहीं, सोचना ही नहीं है। तुम अर्जुन हो, तुमको चिड़िया की आंख देखनी है, तुम एक क्षत्रिय हो, क्षत्रिय का धर्म होता है लड़ना, हार होगी कि जीत होगी ये नहीं सोचना है, सब मोह माया है। तुम्हारा काम है लड़ना, तुम्हारा काम है एग्जाम देना, तुम्हारा काम है ऑप्शन में मार्क करना, ये नहीं सोचना कि वो सही होगा कि गलत होगा। हाँ तुम्हारा काम है कि जब तुम उस एग्जाम को दे रहे हो तो पूरा फोकस करना है और हमको कोशिश करनी है लॉजिक लगाते हुए, कॉन्सेप्ट लगाते हुए, भले ही हमने कम चीजों को पढ़ा हुआ है लेकिन उस कम चीजों की लाइब्रेरी में अपने को दिमाग को ले जाते हुए उन चीजों से आंसर को करना। ओके तो याद रखिए, लाइफ इज बेटर व्हेन यू आर लाफिंग, इसलिए खुश रहो, मस्त रहो, स्वस्थ रहो, व्यस्त रहो, मस्त रहो। ऑल द बेस्ट, गॉड ब्लेस यू ऑल। इसके अलावा बेटा हिस्टोलॉजी और एम्ब्रियोलॉजी में हमने बुलेट ट्रेन एनाटॉमी में पहली जो चीजें की थी उन चीजों को मैं फिर से कहना चाहता हूं। बहुत ज्यादा टाइम, यस डोंट गिव द टू मच टाइम फॉर द योर यस embryology and the histology, so go for the bullet train anatomy। I told you the dermatome, sure short one question is going to ask from this our dermatome topic, go for the bullet train anatomy। yes embryology, the development part, general embryology we had seen, all the inner cell mass, outer cell mass, then our epiblast, hypoblast, endoderm, just go for the our yes bullet टेरिनोटमी, pharyngeal apparatus no excuse, I told you in the bullet टेरिनोटमी, तो सिर्फ उसको पढ़ के जाना, थोड़ा सा आप ये जनरल एम्ब्रियोलॉजी को देख सकते हो। yes we had described this all the things and how there is the ectoderm, mesoderm, endoderm was formed and how there was the nucleus pulposus was formed and it was compressing in case of the disc prolapse, you have to observe. Also you have to see the our development of the neural crest cells and the central nervous system. I told you the formula of the lip, lateral plate mesoderm, intermediate plate mesoderm and paraxial mesoderm. Okay, so these all are the points. Development of the CNS, you have to see the neural crest cells derivative, जिसके लिए हमने एक बढ़िया सा ट्रिक देखा था, ऑफ्स गायनी के साथ इंटीग्रेट किया था। दिस वाज द इंपॉर्टेंट पॉइंट्स। यस एनेंसेफली वाज इंपॉर्टेंट, यू कैन गो, सेम थिंग है, तो मैं इसको रिवाइज नहीं कर रहा हूं, जस्ट स्लाइड आपको दिखा रहा हूं ताकि आप उन चीजों को रिकॉल कर सके। yes so the only these things you have to study. yes neural crest cells derivative, we had created the mnemonic, this one terrorist, and this was our mnemonic Pitts doing disco in front of the Mahamana Madan Mohan Malvi. This was our funny mnemonic for the neural crest cell derivative, and this was the our cartoon to remember them all. And histology, one thing I want to tell you, in histology, cartilage and collagen you must study. Cartilage and collagen, cartilage and collagen, I am telling you. And for the histology, the epithelium, you can see different epithelium, how to identify the squamous epithelium, yes cuboidal epithelium, and then pseudo-stratified ciliated epithelium. I told you in the previous part, bullet train anatomy, please go for that. This is our columnar epithelium, and here is the stratified squamous epithelium, which is our non-keratinized, and this is our transitional epithelium, urothelium. This is important slide, you all must know. And then we had seen the extra thing like the skin. Skin is important, integrate with the skin. If there is a blockage, there is the holocrine gland, sebaceous gland, there is the accumulation of the sebum. Yes, remember this is our holocrine gland. Skin is important, acne is important, dark band, light band, skeletal muscle you have to say, yes intercalated disc, cardiac muscle you have to say, there is the fusiform cells, so this is the our smooth muscle, and don't forget this one, cartilage. yes you are looking the chondrocytes outside, homogeneous glossy appearance, so this is your yes hyaline cartilage. Remember this mnemonic, hyaline cartilage, GF car, G for growth plate, F for fetal cartilage, C for costal cartilage, A for articular cartilage, and R for respiratory tube. I told you biryani, when you are eating the leg piece, chicken piece, the ends of the bone, they are having the cartilage. Yes, which cartilage? Hyaline cartilage. Then I told you the elastin cartilage, chondrocytes are there, लेकिन बाहर में आपको कचड़ा मिल रहा है, सिंगल कचड़ा, डबल कचड़ा. So this is our elastin fiber. These are found in our ETC cartilage. E for ear pinna, E for Eustachian tube, E for epiglottis. 3E you can remember, 3T you can remember. Tip of the nose, it is very soft, it is showing the elasticity. Tip of the arytenoid tritiate cartilage, also the corniculate and cuneiform. इतना ही पढ़ना है, ज़्यादा नहीं करना है. At the last time of the exam, only revise that bullet train anatomy PDF. Don't watch the video also, I am telling you. And yes, this is our thick red bundle in between the chondrocyte. So definitely this is our collagen bundle. So it is our Fiat, yes our fibrocartilage. Where it is found, I told you the mnemonic Fiat logo. So F for fibrocartilage, I for intervertebral disc, A for articular disc, T for tendon insertion, L for labrum. So these are the points. And then I told you about the cartilage also. Don't forget this one, cartilage and collagen. Many types of the collagen, more than 28 types according to the our yes Ross histology. Type 1, type 2 and type 4, they are important. Type 1 is found in the ball, B for bone, A for aponeurosis. Aponeurosis is nothing, flat tendon is known as the aponeurosis, and L for ligament. So remember this is found in our type 1 collagen. And yes, here in this structure type 1, type 2, this is very important, cartilage is having the type 2 collagen, don't forget it. And kidney, in the kidney and our lung there is a type 4 collagen. I told you kidney basement membrane, type 4 collagen. If there is the mutation, then there is the hematuria. And also in our lung there is the type 4 collagen. If there is a damage, then there is a hemoptysis. So this is our good posture syndrome, which is showing the our yes remember this good posture syndrome, it is mutation in the type 4 collagen. Okay, one patient is coming with the hemoptysis, hematuria, and there is a type 4 collagen mutation. What is your diagnosis? Good posture syndrome. So these are the points for all of you we had seen. So thank you very much. This is the same thing at the last. Success is not permanent and failure is not फाइनल. मेरे बच्चों याद रखना, नेवर स्टॉप वर्किंग आफ्टर द सक्सेस. अभी एग्जाम होगा तो आप में से कई सारे बच्चे हार्ड वर्क के कारण और थोड़ी सी किस्मत के कारण सेलेक्ट हो जाएंगे। लेकिन ऐसा नहीं कि अब कहानी खत्म हो गई, नहीं, कहानी तो शुरू होती है। You have to do again your job properly and never stop trying after failure। अगर आप फेल हो जाते हैं तो क्या जिंदगी की कहानी खत्म हो गई? रिमेंबर, डॉक्टर एपीजे अब्दुल कलाम ने कहा है, फेलियर इज नॉट द फाइनल। जब तक आदमी कोशिश करता रहता है तब तक वो आगे बढ़ता रहता है, चाहे वो सेलेक्ट हो चाहे वो सेलेक्ट नहीं हो। कोशिशें करना अगर आपने बंद कर दिया, आप सेलेक्ट हो गए लेकिन अब हो गया यार, जितना करना था, अब आराम की जिंदगी जीते हैं, यू आर लीविंग द लर्निंग कैपेसिटी। ये आपका सिलेक्शन नहीं है, ये आपकी हार है। यस, अगर आपका सिलेक्शन बाय द वे किसी कारण से नहीं होता, सॉरी फॉर दिस, आपका सिलेक्शन बिल्कुल होगा, लेकिन फिर भी लाइफ में कुछ भी हो सकता है। लेकिन अगर आप कोशिशें करते रहते, इसका मतलब यह है कि आपका सिलेक्शन हो गया है। सो थैंक यू वेरी मच। अगर कुछ गलती हो जाती तो प्लीज मुझे आप माफ कीजिएगा, अगर कुछ ज्यादा हो गया, कुछ कम हो गया, फिर भी मैंने अपनी तरफ से एक बहुत ही बेस्ट करने की कोशिश की है। कहानी और भी है, और भी चीजें कर सकते हैं, बट ओके, you all are having the exams also. So, says thank you everybody. Yes, Garg sir is here. Sir, thank you so much for your blessings always. I'm very thankful to Garg sir and all the legends sir in our team, our विवेक जैन सर, स्पर्श गुप्ता सर, अपूर्व मेहरा सर। इनके कारण मैं टीचिंग फील्ड में नेशनल लेवल पे आ पाया, तो मुझे बहुत अच्छा लगता है। प्रवीण त्रिपाठी सर यहाँ पर है, जैनब मैडम यहाँ पर हैं, यस, दिलीप सर इज हियर, आवर एमएचडी सर इज हियर, प्रियंका मैडम इज हियर, आनंद सर इज हियर, अमृत सर इज हियर, जानवी मैडम इज हियर। आई एम थैंकफुल टू एवरीबडी। यस, विपिन नागपाल सर यहाँ पर है, थैंक यू सो मच एवरीबडी। और सॉरी अगर मैं कोई नाम नहीं ले पा रहा हूँ ड्यू टू द इमोशन। आई एम थैंकफुल टू ईच एंड एवरी स्टूडेंट ऑल्सो। थैंक यू बेटा। So any question more, any doubt? Yes, this PDF you will get at our Telegram channel, Cerebellum Academy. Okay, so here is the one very good news. Our respected Garg sir is having the session on the 3rd. तो इस दिन माहौल बनेगा। Okay, fine. So here my respected sir, Apurva Mehra sir is here. Sir, I'm very thankful. I want to inform to all the dear students, सबसे पहले मैं डॉक्टर अपूर्व मेहरा सर से मिला और उनके कारण मुझको दिल्ली में पढ़ाने का मौका मिला। उस समय एक PGDIMS करके कोचिंग इंस्टीट्यूट हुआ करती थी, तो मैं अपूर्व सर का बहुत बहुत ज़्यादा थैंकफुल हूँ। और सर यहाँ पर आए, सर थैंक यू सो मच, चरण स्पर्श, सादर प्रणाम। Okay, and I'm also very happy that students from the our आर्या सर, स्कूल टीचर हैं मेरे, वो मेरे गॉडफादर हैं, अक्सर मैं उनको याद करता हूं, तो आर्या सर के भी स्टूडेंट यहाँ पर आए, बहुत अच्छा लगा। So thank you very much, thank you very much. Okay beta, any more doubt, any more doubt? Otherwise your exam is closed, we are going to end the session. Okay, fine. यस, थैंक यू संजीत, थैंक यू। फिर भी ये क्विक रिवीजन सेशन था, कई सारे कॉन्सेप्ट हम नहीं लगा पाए। यू कैन गो फॉर द अवर बुलेट एनाटॉमी, देयर लॉट्स ऑफ द कॉन्सेप्ट वाज देयर। ओके, फाइन, थैंक यू डॉक्टर संजीत। एनी डाउट बेटा, एनी डाउट, एनीवन, एनी डाउट यू कैन आस्क। एंड नाउ वी आर गोइंग टू क्लोज द सेशन ऑल्सो। यस, थैंक यू एवरीबॉडी, थैंक यू सैयद, थैंक यू, गॉड ब्लेस यू बेटा। ओके, सो एट द लास्ट फ्यू लाइंस फॉर ऑल ऑफ यू। देखो बेटा, हम सभी क्या कर रहे हैं, नीट पीजी के एग्जाम में बस दौड़े जा रहे हैं, भागे जा रहे हैं। नीट पीजी में सिलेक्शन हो जाएगा, जब हम पीजी में आ जाएंगे तब लगेगा कि यार वो यूजी लाइफ ही अच्छी थी। फिर नीट पीजी करने के बाद हम सोचेंगे कि चलो भाई अब हम एमडी कर लेते हैं, डीएम कर लेते हैं, हम एमसीएच कर लेते हैं, और इस तरीके की जिंदगी कहानी बढ़ती जाती है, बढ़ती जाती है, बढ़ती जाती है। याद रखिए, यस, जीवन की आपाधापी में, जीवन की इस दौड़ भाग में कब वक्त मिला कुछ देर कहीं पर बैठ कभी ये सोच सकूं, जो किया कहा माना उसमें क्या बुरा भला। फिर से हम एक रेस में दौड़े जा रहे हैं, एक रेस में दौड़े जा रहे हैं, और हम बस सक्सेस होना चाहते हैं, सक्सेस होना चाहते हैं। आराम से ठंडे दिमाग से कभी सोचिएगा, आपका सिलेक्शन जरूर होगा जब ये थॉट्स आपके अंदर आ जाते हैं। याद रखिए, जीवन की आपाधापी में कब वक्त मिला कुछ देर कहीं पर बैठ कभी ये सोच सकूं, जो किया कहा माना क्या बुरा भला, मेला जितना भड़कीला रंग रंगीला था। नीट पीजी का एग्जाम जब आप दे रहे हैं, आप एक सेंटर में जा रहे हैं, आप इस दुनिया में हैं, तो यहां पर कई सारी चीजें हैं जो हमारे ध्यान को डिस्ट्रैक्ट करती है। मेला जितना भड़कीला रंग रंगीला था, मानस के मन में उतनी ही कमजोरी थी, जितनी ज्यादा संचित करने की ख्वाहिश थी, उतनी ही छोटी उसके कर की झोली थी। हम जब सोचते हैं कि हम ज्यादा से ज्यादा चीजों को अपने लाइफ में बटोरेंगे, हम सक्सेसफुल नहीं हो पाते। इसलिए कोशिश उतना ही करो जितने आपके हाथ में समा पाए, और उसमें ही खुश रहने की कोशिश करो। यस, मेला जितना भड़कीला रंग रंगीला था, मानस के मन में उतनी ही कमजोरी थी, जितनी ज्यादा संचित करने की ख्वाहिश थी, उतनी ही छोटी उसके कर की झोली थी। मुझसे पूछा जाता है क्या मैं बतलाऊं, क्या मान अकिंचन पथ पर मैं दोहरा आया। है कौन रतन अनमोल मिला ऐसा मुझको, जिस पर मैं अपना मन प्राण निछावर कर आया। याद रखिए, और भी इसमें कई सारी प्यारी प्यारी लाइनें हैं, लेकिन हम बस दौड़े जा रहे हैं, भागे जा रहे हैं। आराम से ठंडे दिमाग से सोचिए, बिल्कुल कूल रहिए, बिल्कुल रिलैक्स रहिए। जितना पढ़ना था हो गया, घबराने की कोई बात नहीं है। अच्छे से सोइए, अच्छे से खाइए, बस पन्ने पलटने हैं। और एग्जाम का वो जो 3 घंटा है, उसमें आपको अर्जुन बनना है, चिड़िया की आंख को देखना है। 4 ऑप्शन होंगे, भले आपने कम पढ़ाई की है, लेकिन उस पढ़ी हुई चीज में से आपको आंसर खोजना है, आपको मार्क करना है। सिलेक्शन होगा कि नहीं होगा, ये आपका काम नहीं है। मैं सही आंसर टिक कर रहा हूं, मैं गलत आंसर टिक कर रहा हूं, ये आपका काम है ही नहीं। आपको बस सोचना है, अपना कॉन्सेप्ट लगाना है, और जो बेस्ट लग रहा है उसको मार्क करना है। और ये कुछ लाइनें आपको याद रखनी है, बिल्कुल आपका सिलेक्शन होगा। ऑल द बेस्ट, गॉड ब्लेस यू ऑल। कैन वी एंड द सेशन? Okay. Yes, Anand sir is there here. Hello, sir. My all the respected teachers. Yes, Anand sir का एक बहुत ही प्यारा लाइन है, लाइफ इज ऑलवेज ब्यूटीफुल, वेरी वेरी ब्यूटीफुल लाइन्स। यस, थैंक यू सर, थैंक यू। सो कैन वी एंड द सेशन? अगर मेरे रिस्पेक्टेड टीचर्स कहते हैं कि हम सेशन एंड करें, तो हम कर्म करते हैं। यस बेटा, ABCD, बिल्कुल वो चिड़िया की आंख, आर्य सर की वो लाइन याद रखनी है। अर्जुन, चिड़िया की आंख, उनका स्टाइल याद रखना है। ओके, यस, यू हैव टू ओनली लुक ओवर द चिड़िया की आंख। ओके, फाइन। सो थैंक यू वेरी मच, we are going to end the session. Thank you, so nice lines from all of you. Okay, burn wala rule. Yes, fine. Okay, so thank you very much. Yes, so Garg sir is leaving. I was waiting for his order. तो बेटा अब हम सेशन को बंद करते हैं। Okay, so it is very late now. Go for the study. Okay, I'm closing the session बेटा. Okay, go and study, take healthy sleep. Okay, हम सभी टीचर्स आपके सिलेक्शन का वेट कर रहे हैं, और बिल्कुल सिलेक्शन होगा। बाय बाय बेटा, बाय बाय एवरीबॉडी। आई एम क्लोजिंग द सेशन। मेरी टेक्निकल टीम भी चली गई है। ओके, बाय बाय एवरीबॉडी। ओके